Assalamu alaikum. We are ready to get started with the speaking portion of our program. So if everyone can please just head to the seating area in the middle. The booths will be closed during this time. So all of the volunteers at the booths can join us at the seats in the middle, and we'll get started. Thank you. Okay. Thank you to those that heard the last two announcements. I'll ask one more time if even the booth volunteers, anyone who's at the booths, if you can all come and sit in the middle. We're going to get started with the speaking portion of our program now. Right here because I knew you might want to stand up, but I realized if Mariam's late, then let's just give her a little grace till I squeeze in. Instead if I put her in the middle, it's kind of rude. But you could take your seat from now. I think Dr. Joad's calling all the other speakers up too. How are you? Thank you for the support always. You're always there, right? Hey,
how are you? I was rushing. I was like, I hope we haven't missed our thing. Because so mad. Did he fall asleep or not? Fine. It was giving me all that pajamas to sleep and all those
Salam alaikum and welcome to our third annual Health and Wellness Fair. Before we get started, I'm going to call Brother Ali Rada Darsi to the front to help us open the program with a few verses from the Holy Quran. Let's welcome him with a loud salawat.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وإن تعودوا نعمة الله لا تحصوها إن الله غفور رحيم. This was Surah Nahl verse 18. The translation of this verse is, if you try to count Allah's blessing, you would never be able to number them. Surely Allah is all forgiving and most merciful. This verse from Surah Nahl teaches us that Allah has given us so many blessings that we could never count them all. Everything we have, like our family, food, health, even the air we breathe, is a gift from Him. It also reminds us that even when we forget to thank Allah, He is always forgiving and merciful. Allah's kindness and love are endless, and we should try our best to be thankful every day.
Thank you so much, Ali Rida. That was beautiful. Let's have one salawat for Brother Ali Rida. Allahumma salli ala Muhammad wa ali Muhammad. So as I mentioned, we are blessed to be here for our third annual Health and Wellness Fair. Many professionals have volunteered their time and their expertise to come here and support you. So please make sure to take advantage of the booths when they open up after this panel is over. An event like this takes many worker bees behind the scenes. Individuals who have been planning for months beforehand, contacting all of the professionals within our community, working late at night. Last night there were people here until late setting up the tables, early this morning, organizing the food and all of that. A few special mentions to Brother Ali Jawad Jivraj, Sister Ruhaina Darsi, and Sister Shaheen Lakhani, who were instrumental in making sure that this program was possible. I'd also like to thank Sister Rehana Jaffer, our chair lady, and her team. They always support all of our programs, and when you take a moment to enjoy the chai and the fruits and all the other snacks afterwards, please make sure you thank them in person as well. We are also blessed to have the unwavering support of our EC, specifically Brother Hasnain Aziz and Brother Muntazir Jamal and their volunteers. And again, they always support these programs and make it possible for all of these professionals to come into our center and be available for you. I would like to invite Brother Hasnain Aziz to the front to share a few remarks. A few short remarks. And sorry, one quick mention. Those of you in the audience who have been registered for the Teen Boys program, you can stand up right now and join Sister Ruhaina, and she's going to lead you to your program. And those of you who are registered for the Teen Girls program, you can look for Sister Natasha, and she's going to lead you to your program.
Assalamu alaikum, everyone. Everyone gathered here today, attending this wonderful event, our annual Health and Wellness Fair. Our elders, our brothers, our sisters in Iman, Salamun alaikum. Every year, this program just continues to grow, adding more and more aspects of healthcare for the betterment of our community. And I must begin by thanking the wonderful team put together by Ali Jawad Jivraj and his better half Shazia, to go with the most amazing set of individuals who it seems like have been working on this for months, probably since last year's event, focused on what they incorporate further, a continuous improvement approach. And our deep appreciation to our medical professionals who have volunteered their time today and will be a part of some very informative sessions, in addition to being available to you on a one-on-one basis for consultation. And I would like to particularly mention two professionals who have come from far. Sister Nzinga Abdullah Aziz, my long-lost sister, because my name is Hasnain Aziz. Where is this sister? Son, Jazakallah khair. And by the way, I'm from Ifakara, Tanzania. A hospice and a palliative care nurse who has traveled from far and we'll hear from her during the panel discussion, and she'll also be running a grief circle. Also accompanying her is her close friend, Sister Latifa Barnett, who has traveled with her and will be addressing our madrasa parents tomorrow. Where is Sister Latifa? Is she here? Oh, she must be on her way. She's on her way. Fantastic. The Health and Wellness Fair is the brainchild of Brother Ali Jawad Jivraj, and this is our third annual event held here at Al Mahdi Center. His good work has been supported by Sister Ruhaina Darsi, Sister Shaheen Lakhani, Brother Firdos Muqaddam, and Brother Muhammad Habib, our directors of operations, who have been tremendous. And of course, Sister Rehana Jaffer, our chairlady, and all of them, along with a dedicated team of volunteers who go out of their way to support and facilitate this program to ensure our community at large benefits. These are the unsung heroes. And of course, Brother Riyaz Remtullah, who carried out all the printing of the materials you will see today. This event has caught the attention of our other communities in North America. And I understand officials of NASIMCO, which stands for the North American Shia Ithnashi Muslim Communities, an organization to which we, the Shia Ithnashi Jamaat of New York, are also a member of. And we collaborate very closely on our events. I'm delighted that they are online watching, and hopefully they can help liaise with our other North American communities on the positive impact this event is having on our community, and inshallah a similar model can be followed elsewhere in other communities. I also see Sister Famida Mohamed Ali here. Where is Sister Famida? She's right there as always, being very quiet but observing. She is our Secretary General of NASIMCO, and I'm so glad that she's here with us because she can relay firsthand what has transpired, but she's also a volunteer for this event since the program started. Thank you so much, Sister Famida. As for our community members gathered here, please take advantage of what is in store. Men's nutrition and fitness on health lifestyle, prevention and well-being, which covers all aspects of our health, and an opportunity to consult with our experts on things that matter: blood pressure, glucose, flu shots, cancer prevention, nutrition, home health care, applying for Medicare in order to have medical insurance, prescription savings. These are all the things that matter when it comes to our health. And I know I've missed out a few more. Please take advantage and meet with the experts. I'm also so happy that the team in front of this event have also incorporated programs for our teens. There'll be a discussion on practical tools for managing anxiety and stress, and sessions on yoga, self-defense, motivational talk, and fitness and training. Honestly, what a brilliant idea. A special thank you to all our young volunteers who time and again continue to support the work being done at our center. And you'll see them wandering around. Aryan Khalfan, Ali Raza Chawiwala, Riza Aziz, Reena Panjwani, Sabah Fatima Jivraj, and Malika Saleh Muhammad. And I'm sure I've forgotten a few more. These programs are hosted so as to bring the community together and not only create a bond, but also to have the community have access to some of the best healthcare professionals, and we have them, and so please take advantage. Once again, our Jamaat's deep appreciation to our team in front of this annual event, and as I've mentioned to both Shazia and Ali Jawad, whatever support and resources you need from my administration, just say it and it'll be done. You continue to raise the bar for the betterment of our community, a healthier community, and no investment is too much. We will always support this program, and a big thank you, asante sana, to both of you and to the fantastic team you have assembled working ever so hard behind the scenes. May Allah subhanahu wa ta'ala bless you and all the families of all the volunteers for your dedication and commitment. Can we please honor all of them and all the volunteers with the loudest of your voices, salawat. Allahumma salli ala Muhammad wa ali Muhammad. Thank you once again. Jazakallah khair.
Thank you so much for those remarks, Brother Hasnain Aziz. I would now like to invite Sister Famida Darsi. As Brother Hasnain Aziz mentioned, we're so blessed to have the Secretary General of NASIMCO with us today, and she would just like to share a few short remarks.
Thank you so much. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم إني أسألك فاطمة وأبيها وبألها وبنيها والسر المستوزي فيها Allahumma salli ala Muhammad wa ala Muhammad. Thank you very much for the coordinators for inviting me to speak a few words on behalf of Nasimco. Health and Wellness is a new initiative within our organization under Sister Shaista Bimji of Orlando. And we're excited to see events like this come to life at the community level. Our team is following programs like today closely to learn from their successes and explore how this format can be uplifted to fit or to cater to all Jamaats under Nasimco on a regional level, inshallah. Thank you so much to SIJNY for pioneering a blueprint. Collaboration and promotion are key, and we look forward to incorporating this style of work in our future offerings from Nasimco for all of our member communities. As we gather in spirit of service, we're reminded of Sayyidah Fatima Salamullahi alayha, the daughter of Rasulullah sallallahu alayhi wasallam, whose compassion, generosity, and care for the well-being of others continues to inspire each and every one of us. On behalf of your regional entity, Nasimco, we wish all participants, vendors, and professionals great success. May Allah subhanahu wa ta'ala grant you barakah in your efforts and reward you in service to the community. Wassalamu alaikum wa rahmatullahi wa barakatuh.
I was going to give you a quick overview of the program, but I think that you have heard many introductory remarks, so I will save that for the conclusion of this panel. Without further ado, I will pass the mic over to Dr. Saira Madad. She will be our moderator for this program. Just as way of introduction, Dr. Saira Madad is an internationally recognized public health leader and the Chief Biopreparedness Officer at NYC Health Plus Hospitals. Dr. Madad has led responses to Ebola, COVID-19, and more. A Harvard Fellow and Fortune 40 Under 40 honoree, she has been featured in Netflix's Pandemic and the New York Times. Her work bridges science, policy, and community resilience. On a personal note, I just have to say how blessed we are to have Saira in this community. She is always willing to drop everything and help out at any event, no matter whether it's a large event or a smaller scale event. And personally, I'm just so thankful to her for that. So please let's welcome this panel with a loud salawat.
Assalamu alaikum, everyone. It's wonderful to be here with you all today. So today's session brings together experts from heart health, physical therapy, orthopedics, psychology, and integrative medicine to help us explore how prevention and well-being intersect across disciplines. So it's my pleasure to briefly introduce each of our panelists today. After I introduce them, I'm going to ask each of our panelists to spend a couple minutes giving just an overview of what they do. And then I'll have some directed questions to each of our amazing panelists. We'll have some group questions, and then we'll open up to Q&A. So that's just a general format for you all. So please feel free to come up with any questions, and then we'll have a brief Q&A at the end. So I'm going to start first by introducing Dr. Ibrahim Isa. Dr. Ibrahim Isa is a board-certified cardiologist specializing in nuclear cardiology at North Jersey Heart in Hackensack, New Jersey. He is affiliated with Holy Name Hospital and Hackensack University Medical Center. Next, we have Dr. Mariam Bukhari. She's a physical therapist with over 13 years of experience in acute, subacute, and outpatient rehabilitation. She is lymphedema certified and has held leadership positions at New York Presbyterian, Amber Court, and Black Rock Health HQ. Next, we have Mahimina Kalafan, and I apologize if I'm mispronouncing your first name. Mahimina Kalafan is a physician associate with over a decade of experience in orthopedic surgery, currently practicing in Northwell Health. Her expertise spans joint reconstruction, sports medicine, trauma, and spine surgery. Next, we have Dr. Afshan Muhammad Ali, is a licensed clinical psychologist, supervisor, and professor at Adelphi University, and Afshan Muhammad Ali Psychology LLC. Her work focuses on depression, anxiety, and multicultural psychotherapy for individuals and couples. And then lastly, we have Dr. Fayaz Khan, is a physician with a dual board certification in internal emergency medicine, co-founder of CityMD, and a current director of Advanced Medicine LI. His work bridges conventional and integrative medicine to help patients restore health by activating the body's natural regenerative capacity. So welcome to all of our amazing panelists. Thank you all for being here today. I'm going to start by asking you to just give a brief overview of what you do and any information you want to share with our audience today, just within 5 minutes, and then we'll get into our questions. And so we'll start right here.
Sure. Assalamu alaikum, everyone. I'm sorry, I'm tiny, so I'm just going to take this into my laps. So that's what you call a physical therapist with experience, modifying things for your needs. So first of all, assalamu alaikum, everyone, and I thank everyone for this opportunity. Dr. Jawad especially, and I'm such a huge fan of Dr. Sarama that I'm sitting right next to her, so you can hear the voice a bit shaky, but I'll be fine in a little bit. So basically, I'm a physical therapist for over 13 years. Thank God I don't look it, but I have experience with majority of geriatric population. I've actually worked acute, subacute during COVID, and majorly with geriatric population with various health conditions. So this is something, my topic today is about falls in elderly, and this is something that is very common with everyone, but it affects our loved ones the most, that are above 65 years of age. And although it's considered a normal aging process, I would say that it's not me, it's a serious health concern. Demographically, there are a lot of people that would say that over 45,000 people within New York every year are going to the emergencies due to falls. So my presentation is just to cover 3 topics about why people fall, the risk factors, to how to prevent or what to do during a fall and how to prevent a fall. So those are just certain things that I'm going to cover today. Are we presenting now or? Sorry.
We'll present in a few minutes.
Okay.
Yeah.
All right. Thank you. So over to the next one. Sorry.
Assalamu alaikum, everybody. My name is Mahimna Khofan. Thank you for the introduction, Syra. I am a physician associate in orthopedic surgery. I've been doing that for over 10 years now. Of course, that's a pretty broad, subspecialty. Today, my topic is going to be on total joint replacements. But on a day-to-day, I cover a wide variety of orthopedics. Joints are just a little part of it. Spine surgery, sports, fractures, and all reductions. On a day-to-day, I mostly work inpatient. I don't really work on the outpatient side, so I see patients only in the hospital. I see patients in the ER with broken wrists and ankles, and I, reduce them. I put them back into place. I put, dislocated shoulders back in place, things like that as well. And then in the OR, we do, different types of surgeries, and I'm going to go through joint replacements later with you. Thank you.
Assalamualaikum. Okay, this is better? Okay. Assalamualaikum. My name is Dr. Afshan Muhammad Ali. As you've mentioned, I do work currently in private practice, but a lot of my experience comes from working in hospitals such as Nassau University Medical Center and a few hospitals in the city. A lot of my work currently has to do with treating a broad range of mental issues such as depression, anxiety, mood disorders. But today's topic will be on depression. And since in the spirit of talking about prevention, I think it's important to clarify that we're not necessarily preventing depression from happening, but being proactive as to how a depressive episode might play out. And I find that there are some factors that some of us are more inclined towards being vulnerable. So I'll discuss, a few of those factors. it takes an intersection of factors for depression to actually manifest, but that also means that mental health in itself is not this black and white thing. Mental health puts us on a continuum. So we're not necessarily healthy, unhealthy, depressed, not depressed, sick, or well. We can actually discuss this in a way of how are we doing along a spectrum. Because there are so many factors that contribute to that, then there are so many ways that we can actually alleviate that. So that gives us a lot of empowerment. Like I mentioned, the other things I do are treating anxiety and depression, and a lot of what I do is teaching. So even in session, I find myself giving a lot of psychoeducation. So hopefully we'll do a little bit of that today.
Bismillahirrahmanirrahim. وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِ. When I am sick, it's He who cures us. My name is Dr. Isa Ibrahim. I'm a general cardiologist, invasive cardiologist, and subspecialize in nuclear cardiology, where we do nuclear medicine. In diagnosis ischemic heart disease, which is the most important common cause of majority part of the heart disease. You know, as you all know, heart is just like a powerhouse. It's the powerhouse of the body, and it has walls, it has valves, it has the blood supply, it has the electricity. So each and every disease of these components can affect the heart. But 50% of the heart disease comes from the ischemic heart disease, from the coronary artery disease, where there's a blockages in the arteries going to the heart. I mean, where we also specialize doing the nuclear medicine, in which we diagnose the percentage and the extent of the ischemic heart disease, of the heart disease. Later on, I will explain you all the symptoms, the signs, the modalities of treatment nowadays, and make you aware of how to approach this disease. By Muhammadin Ali Muhammad Salawat.
Bismillahir Rahmanir Rahim. Allahumma salli ala Sayyidina Muhammad Ali Muhammad. I'm a little confused. Is this the 7-minute thing that we do now, or no? No. Oh, this is just a brief introduction? Okay, all right. My name is Dr. Faiz Khan. In my past life, I did a dual board in internal medicine and emergency medicine. As Syra had mentioned, I went on to become chairman of medical ethics, chairman of emergency medicine, residency director, did a lot of administrative stuff, academic stuff, published and lectured nationally and internationally on conventional medical themes, like a lot of the stuff you're hearing today. My last dance with conventional medicine was I was the founder of CityMD. Most of you guys probably know CityMD. So we started doing that because imagine having to go into the emergency room for a simple cut or a sprained ankle. That's horrible. That was the case in Long Island and Manhattan until we stepped into the picture. So after that, for the past, I guess since 2017, I've been doing something called integrative medicine, where I combine conventional medicine and other healing arts from outside conventional Western medicine to address chronic disease. I am not at all impressed with the way conventional medicine handles chronic disease, and I think any physician that has the opportunity to branch out and acquire new intellectual and technical skill sets would do so. So I've had the opportunity to do that, and I'll look forward, and I'll explain more about that when we. All right. Assalamu alaikum.
Perfect. Thank you so much. And as you can see, we have such a powerful panel here with us today, so please do take advantage of all the knowledge that we have here. So what I'm going to do is I'm going to ask each of you just a high-level question, and once you answer it, please feel free to add on anything else. I believe some of you all have presentations, so if you could just be succinct in your presentation so we can cover a lot more ground. So after my question, please feel free to share anything else that you want if you have a presentation or the like. So I'll start in order here on my right, so with Dr. Mariam Bukhari. So my question for you is, falls among older adults are a major cause of injury and loss of independence. What early risk factors or subtle changes should families look out for to intervene before a fall happens? And again, please feel free to talk about your presentation.
I think this time I'm just going to grab it. Ooh, better. Okay, so the question is, what and how can we recognize these falls, early on with the patients? First of all, the risk factors for falls is usually, in the normal process, people over the ages of 65. But there are factors, that cause it. It could be physiological, it could be environmental, It could be, you know, a medication that's causing it. It could be a new condition causing it. It could be a lot of things, you know. So the first thing I would say is, if it's a person above the ages of 65 and has already had a fall, that's a significant concern. When somebody has already fallen once, with or without any injury, that needs to be taken very seriously, because you may not have an external injury, but you may for sure, or God forbid, have an internal injury or an internal bleed or a factor that is undiagnosed, like an inner ear condition, like a loss of vision. You know, these are certain things that come with age, and sarcopenia, loss of muscle mass, you know, when you're getting older. People say, you know what, I could walk, but suddenly I feel like I'm gonna fall. So I'm afraid of falling. When you think that, and when you're, I would say if you're above 65, fall screening is a must, and it's advisable to do it with, you know, at a local mosque, or you could do it at a local health center. And we have City MD. We have all these, you know, places where we reinforce fall programs, you know, where one can recognize. So I would say early on, you want to see if there's any vision loss, if there is a person who lives alone is falling, or is falling at night. So it could be the bathroom issue, or it could be a vestibular issue. So things of that nature. But I don't have much time, but I just wanted to give a few pointers, like gait imbalance, could be weakness in the muscles. It could be postural hypotension that a lot of Parkinson's patients have. And you don't have to be 65 for that. I have a mother who's 64, and she's, you know, she has Parkinson's. Luckily, no falls, but, you know, medications, like, you know, certain medications would make you dizzy. Acute illness, like you could have a flu. Some patients could have a flu and they would have a fall. But whenever you fall, do not neglect it. You have to see a doctor. You have to see a health practitioner. You have to discuss ways in order to avoid those, you know. Confusion, cognitive impairment, certain nervous system disorders, epilepsy, stroke, etc., are certain risk factors. So I would look out for those. Thank you. Hope that answered.
No, it's wonderful. Thank you so much for that. My next question is for Mohiminia. Orthopedic issues are on the rise with sedentary lifestyles and sports injuries. What are the most common patterns you see that lead to joint surgery, and how can early prevention or lifestyle changes make a difference? And please feel free to get into your presentation as well.
Yeah, if you could. Okay. I mean, the question was, what can some things that we could do, what are some things we could do to prevent a sedentary lifestyle and ensure that we kind of prevent as much as we can the need for joint replacements? To a certain extent, joint replacements at a certain age are essentially inevitable. It's due to a degenerative joint disease, which means that, you know, as you age, your joints, your bone quality just kind of takes a decline. It's part of the aging process. So I think what's important also is just to understand, you know, what they are, and that they're so common now. It improves the quality of life to replace your joints when you can, you know, when it's necessary. And I think that it improves your quality of life. You can age more gracefully, not have to worry about constant pain with just getting around everywhere. I do have a PowerPoint that I want to, okay, perfect. Do we have the clicker? The clicker? Yeah, thank you so much. Okay. So what even is a total joint replacement? Joint replacements are when we take damaged bone, worn out bone, and we replace them with prosthesis, which is essentially made out of titanium. The most common joint replacements I'm going to go through with you are knee and hip replacements. I'm sure that, you know, you either know somebody that's had a joint replacement before, or you've had one yourself maybe. why do we need our, knees and hips replaced? It's basically due to something that I'm sure we've all heard of before, arthritis. Arthritis is essentially our joints are made out of bone and cartilage. And the cartilage is like a spongy, flexible type of material that serves as a shock absorber when we walk around, when we do our activities. And the cartilage starts to wear away, and that leads to the bones kind of rubbing against each other. That friction, that mechanical stress, it causes, I don't know why it's not working. It causes them to have an inflammatory reaction, and that's what arthritis is. What are the signs and symptoms of osteoarthritis? So the signs and symptoms are, it happens in stages. So the first stage is a more like predictable type pain. Maybe you went to Koja volleyball and now your knees and your hips are hurting. That's stage 1. Stage 2 is when it starts to affect your daily activities. Now you're looking for a parking spot as close as you can to Target, because if you have to walk really far, your knees are going to hurt when you get home. And stage 3 is it's a constant, dull, debilitating type pain. It's there all the time. Patients have swelling to their knees. They start walking with a limp. That's pretty severe. It affects about 32.5 million adults in the U.S. There are some risk factors. So the average age is of diagnosis is around 53.5 years old in the U.S. But as you get older, the risk of arthritis, it has a direct relationship. So as you get older, your risk of arthritis increases. It's more prevalent in females than males. If you are overweight or have an elevated BMI, you put more stress on those joints. So essentially, you would probably need a replacement sooner than somebody else. If your job requires heavy physical stress, and genetics also play a part. So on this next slide, I actually have x-rays. So if you look at the top over there, there's x-rays. And it's an x-ray of the knee, and it just shows the gradual stages of arthritis. So if you look on the left one, there in between the bones there's like joint space. And as you continue moving through the x-rays towards the right, you see that you essentially get that bone on bone that I was talking about, where there's no real space in between your joints anymore in the knee. And the next slide, I have the hip joint as well. So at the top, you see what a normal hip should look like on an x-ray. And in the bottom, it's that bone on bone, the limited joint space, the narrowing there. That's what severe osteoarthritis looks like. So treatments. Conservative management. Most people don't want to just hop into, let me just cut my bones off and get new joints. And you want to consider conservative management or non-operative management first. Some recommendations are oral Tylenol, Motrin, NSAIDs, and then you can consider physical therapy to kind of strengthen the muscles around the area to help with the pain. Some moderate arthritis, you can use a cane or a walking device, braces. Some patients consider a corticosteroid injection, where they inject a steroid into your joints to decrease that inflammation, but it's essentially kicking the can down the road a little bit, but it does help prevent it for a certain amount of time. And then there's limited literature on other modalities such as acupuncture, massage therapy, platelet-rich plasma, and dietary supplements. The next slide, I have actual total knee arthroplasty outcomes. So when you actually replace your joint, what happens? The patients report substantial improvement in pain and function. It's a pretty rapid recovery. The actual implants last a pretty long time, 15 to 25 years. The satisfaction rate for the surgeries are about 90%, higher than 90%. Average age for a knee replacement is around 65 to 66 years old. And patients report improved function and mobility. There are complications of any surgery that you undergo. Risk of infection, blood clots, nerve or vessel damage, the implant loosening or failure of the implant. However, those complications, studies show that it's about 2% of those complications that actually required some kind of operative management to fix. The next slide I have an arthritic hip on the left, and that's actually what the hardware looks like when we replace it. I actually also have brought with me the hardware that we actually use, the actual titanium hardware at the booth if somebody wants to stop by later. So for hip replacements, very similar statistics. You know, the implants last a long time and higher than 90% satisfaction rate. The average age is also 64 to 65. Factors influencing outcomes. So obviously surgeon experience. You definitely want to go and see a surgeon that not only is an orthopedic surgeon, but specializes in specifically joint replacement surgery. Physical condition, so patients that have other comorbidities, other health issues, if you're diabetic or you have, you're overweight, it may slow your recovery time or put you at risk for more complications. Smoking is horrible. I know everyone that you see in medicine tells you do not smoke. It actually it delays wound healing because it prevents oxygen from going into your cells. Adherence to recovery. So like, are you actually listening to the physical therapist when they tell you to, you know, do your exercises? Because it's also you that you need to do your job too. And then age. Younger patients are more likely to require a revision in the future just because they're younger, they're putting more of impact on those implants. So they might need a revision in the future. So recovery timeline. Most patients, they get up and walking the same day. They get discharged from the hospital the same day. And, you know, obviously that's modified. So the first few weeks, you're walking with an assistive device. So you're walking with a walker or a cane or something to kind of make it safe for you to move around. By month 3, your goal is to get rid of that assistive device and to be walking independently and kind of doing your acts of daily living without any kind of assistance. Months 3 to 6, you resume normal low-impact activities, swimming, cycling, things like that are fine. And then by month 6 to 12, you're pain-free, fully recovered, and you can kind of go back to your regular life again. And that's pretty much it, what I have. If anyone has any questions.
Thank you so much. Amazing. So my next question is for Dr. Muhammad Ali. Mental health conversations are becoming more open, but stigma still exists, especially in multicultural communities like ours. How can we create culturally sensitive approaches to recognizing and treating depression? And if you also have a presentation, please feel free to present that.
Of course. So if I understand the question, it's, you know, how do we find an intersection between treatment for any kind of mental health condition and our culture, right? And our culture. Yeah, so you'll find that the field itself is growing in the direction of both cultural competence and cultural humility. So cultural competence, and we'll find this in other fields as well, is the responsibility of a provider to be aware of the different cultures. It's a lot of what do they know? What do they know about working with, for example, you know, those who might identify as Asian American, and of course our kind of Asian American, or Asian from a different place. What does it mean to have experience with immigration? What does it mean to be of a certain set of background variables? There's also, of course, the element of cultural humility. So you'd be looking for a provider that can, yes, know what they know, but also be aware of what they don't know, right? And they look to you to kind of fill in those gaps in a way that doesn't feel overburdensome, but is respectful, it is accommodating, and it is inclusive. So it would be your job to show up to an appointment with a little bit of a readiness to advocate for yourself, to give information, and work with your provider for your treatment. So a lot of this has to do with the collaboration between, and I'll say here, as a therapist myself, you're a therapist and a patient. We were talking a lot about this at the booths as well, is there's a very nuanced way of providing treatment to those of, I would say, our culture, of our ethnic background. So one, understanding where depression comes from. For us, we can probably say that it all boils down to perhaps 3 different categories: biology, psychology, and socio-cultural context. Biologically, it's really has to do with perhaps your genetics. It has to do with your hormones. It has to do with your brain chemistry. For some of us, depending on our age, we've already gone through a number of changes, puberty, menopause, getting older, hormonal changes if we've had children, other kinds of thyroid imbalances. All of that could implicate the manifestation of depression. So now in treatment, right, a lot of the initial conversations in therapy or with any kind of psychiatric provider has to do with your biology. You know, what are your family histories? What has life looked like for you up until now? Other major medical conditions. Psychologically, this is a lot of, you know, the work that I end up doing has to do with negative thought patterns. So kind of what's going on in your mind. Negative thought patterns, and we might have, you know, experience with this too, proclivity or inclination towards perfectionism. So if we're striving towards perfection, which is something that, of course, is impossible to accomplish, but we keep telling ourselves we need to move in that direction and we don't meet that, then of course we're going to feel less than ourselves. I would say other things are trauma. So any kind of trauma, we think about trauma is either capital T or lowercase t. Big T trauma has to do with major life events, perhaps even some types of abuse as early as a young age. Other kinds of trauma also have to do with relational trauma, having poor relationships, having adverse events in those relationships. On the other side of that has to do neglect and chronic stress. So now again, talking about what that would look like in treatment, especially in a culturally sensitive way, how we ask about this information is really important. I'll find that when I'm working with ethnic minorities across the board, this is not something that most patients want to share session one. So they require, I would say, a greater emphasis on developing a relationship with those patients, understanding what it is that treatment is going to look like, and then a lot of education about why we do this work. I joke both with my patients and with those who I supervise, sometimes we have to talk about talking to kind of encourage people to kind of join the space and bring in something that they're ready to talk about in their own time. I would say that last factor that I had mentioned, social environmental factors, this has to do with how an individual relates to their environment. So things such as, are they feeling incredibly lonely? Are there any relationship conflicts that need attention? How are their finances going? Discrimination, which they probably experience either in the workplace, at school, just walking down the street. Major life transitions and chronic stressors. So again, thinking about this in a culturally sensitive way, we probably have a unique sense of stressors. A lot of us might live close to family. We might live a lot of family members in one house. Caregiving. Again, an example we were talking about at the table was you find a lot of people in our culture, they don't leave home before getting married. You might find that going to a provider who's not culturally sensitive will suggest, okay, a lot of your problems are coming from the fact that you live at home, move out. It's not going to happen. It's not usually our go-to. So we need to have both a culturally sensitive understanding as to where depression comes from, and then, of course, what can be done about it. All keeping in mind someone's culture, their comfort with doing something different, and then of course the other characters who are in the room but of course not physically present. So you'll be working with not only your patient, I'll say it in my way, I'm not working only with my patients, but then also their parents are somehow in their room, right? The messages that have gotten internalized, their culture, their community, their society, the different expectations they have of themselves and have of others. All of that is a network that needs to be understood. I'll jump ahead just in terms, since I did reference some of the things that we could be doing to help mitigate how depression does come about. And I had said before that the goal here is not a complete avoidance or elimination of depression. It is a universal experience to feel low at some point in your life. Everybody has this experience. If you come to my table later, I'll give you a feelings wheel. I'll tell you that all of these emotions are universal. So we've all had them. Where depression comes into play is if you've had feelings of lowness, worthlessness, feeling less than yourself for some prolonged period of time. in a way that it disrupts your functioning in other areas. So feeling depressed for more than 2 weeks most likely is impacting your job performance. It's affecting your relationships and how you show up. It perhaps makes it so that you're letting go of a lot of the important, even routines that you've implemented. So a lot of things start to get let go because we're feeling depressed. As I keep mentioning, because there are so many contributing factors and there are so many things that we can do. So for the sake of time, I'll share what I ask my patients to think about in probably one of our first or second sessions. I call them 5 therapeutic activities, and they actually have nothing to do with therapy. So if you're afraid of therapy or you're kind of wondering what it's really about, I'll give you these 5 tips, and you should be at a good starting point. So number 1, and I think we'll probably all identify this, I ask about what someone's sleep looks like. If we're feeling low, if we're not sure, even any other kind of presentation with mental health, if we're feeling like our sleep has kind of gone off course, this gives us something to focus on. So a lot of the questions I ask around sleep have to do with, what does sleep hygiene look like? Are we watching TV or on our phones right before bed? Are we scrolling? Are we WhatsApping? Or what are we doing right before bed? If it has to do with the screen, that probably is already the beginning of poor sleep hygiene. Some of us set our alarms on our phone. I highly recommend having a separate alarm clock. There's no reason that you need to be on your phone also for the alarm setting. You want to have a comfortable room with a good temperature, clean sheets, nice pajamas. I also recommend going to sleep at around the same time every night, give or take maybe half an hour, so that our bodies adjust to an appropriate circadian rhythm, and that we're waking up at around the same time every morning. So there's no reason that we can't prioritize consistency when it comes to sleep. The reason that sleep is so important is because it's kind of like your recharge. When you charge your phone, you charge your battery, you're recharging your mind. Everything gets reset in terms of chemical levels. It also helps with emotion regulation. I'm sure if you guys can think about it, if you don't sleep very well, you're probably impatient the next day or a little irritable, you don't smile as much. That's all, it can come down to sleep. Moving on, I ask about water. I see this a lot more with kids nowadays. Everybody is carrying their own water thermos or their cup. We should be doing that as adults as well. There's no reason not to. We certainly, I believe the current guidelines are we should be taking in somewhere between 11 to 16 cups of water a day. If some of that comes from your food, great, but I think that leaves around 8 cups of water for us. So we should be drinking a lot of water. It's not just about staying hydrated. It's also another way that our body recharges. It promotes proper brain function, and again, helps regulate our mood. Proper diet is a huge one. Sometimes I meet with patients who forget to eat breakfast, which I don't understand. I need to eat breakfast first thing in the morning. But a lot of people either forget to eat or they're eating major meals but not, anything in between, so they're hungry, or, which I'm sure we're also prone to, we're not eating in a way that's very nutritious. So now think about it. Whatever we eat, our brain uses 20% of it for fuel. So now if we're only feeding it things like, somebody mentioned biryani at the table, or if we're only, eating these like fried foods and not balancing it with something else, which I'm sure we can all speak to, then we're not giving our brain the best chance to support us as we're either trying to regulate our mental health or just get through the day. The fourth thing I often recommend is some kind of mindful movement. Now, this does not mean a really high intensity workout. It also, I would say, running around the house or going to get groceries or running errands is also not mindful movement. We need to engage in movement for the sake of movement. This could be as simple as 10 minutes of a walk. It could be simply, I'm sitting at my desk, I'm gonna go walk around upstairs, I'm gonna go, walk downstairs. And again, it's just for the sake of movement. That's all the intention is. This is not just about calorie burn. That's actually not why I mean it. A lot of movement helps increase those healthy neurotransmitters in our brain, such as serotonin, dopamine, those endorphins, which help with our mood. A lot of depression has to do with or is correlated with high cortisol levels, which is stress related. So in movement, our cortisol comes down. Naturally, our mood will also increase. We also, and this is again something I emphasize, is it gives our body a message that we are in control. If we are in control and we've chosen movement, our body feels safe. If our body feels safe, that means a basic need is being taken care of. That means our mind can also feel safe. So it certainly brings that down. And the last one that I often ask about is social connection. And so again, we're in a very community-oriented place just in this moment, so I hope we all feel a bit better. But social support is one of the strongest predictors of good mental health. And of course, as an inverse, it's a protective factor against depression. So it doesn't just feel good, it's biologically necessary. I can get into more of the chemicals when I see you at my table a little later on. But it's the simple things. It's just sending a text to somebody, it's paying someone a compliment, it's calling someone, it's coming here. So I hope you guys can kind of hear this as a menu of options to help target your mental health. And later I'd be happy to hear any questions.
Wonderful. Thank you so much. And I love the menu of options. I will say I just came back from Geneva from the World Health Organization, so I'm trying to get back into my sleep pattern, which I'm so glad that you mentioned in terms of the importance of sleep. And my first meal of the day is always coffee. I always skip breakfast. So it's always a good reminder to make sure that you have a hearty breakfast to start your day. So thank you for those really practical and helpful tips. So next we have Dr. Isa. So question for you, and again, please feel free to share any presentation you may have as well. So heart disease remains a leading cause of death here in the United States and worldwide, yet so much of it is preventable. What early warning signs do you wish more people recognize, especially among our particular community?
Thank you so much. You need to have a good heart to feel good and to go through hip surgeries. Okay, so it is very true that the number one cause of death in the United States in 2023 was like 700,000 people died from heart disease, of which 50% is because of the atherosclerotic heart disease. When I say atherosclerotic heart disease, I mean the cholesterol buildup within the arteries. What are the factors that makes the cholesterol build in the arteries? Now, remember one thing, the most important thing is just like a sun, you know. The weight is very important. We have to be very careful not to put on weight and be within our BMI or waist hip ratio. Once you prevent the overweight, all the other factors, the high blood pressure, the diabetes, the high cholesterol, will have a control. I mean, definitely. Otherwise, what happens actually once you put on weight, I mean, especially for us, I mean, you know, as we grow older and we eat and we do we party out and everything, we put on weight, and this weight then invites other factors, the high blood pressure, the diabetes, the high cholesterol. And of course, there are other certain factors that is unavoidable. Example, genetics. If you have a family history of premature coronary artery disease in that your father or your mother had a heart problem below the age of 55, then at least if you control the risk factors, you can prolong the event. Otherwise, you are hit at the age of 40 or 50 with massive heart attack. Now, remember one thing, I mean, heart has walls, the disease of which is called as cardiomyopathies, has valves, the disease of which is called as the stenosis or regurgitation. The disease of the conduction system is called as arrhythmias. The disease of the covering of the heart, the pericardium, is called as pericarditis or pericardial effusion or anything. And then the most important thing is the arteries of the heart. The arteries of the heart are called as coronaries, and these are the most important component of the heart. I mean, it supplies the heart, it causes the heart to beat. The stronger it beats, the better the perfusion, and that's where we have to give more importance. What are the risk factors? As I've mentioned, I mean, overweight, very important. So you have to be careful. Do not cross the body mass index of more than 30. The hip to waist ratio should be not more than 1. Try to exercise, diet, Mediterranean diet, exercises are the most other important factors. Now we come to symptoms. What are the symptoms of this heart attack? I mean, it's very important, I mean, to differentiate between the men and women. Men sometimes have different, and those people who are diabetic will have different symptoms. The most important thing is a chest pain or pressure. You go out, you're walking, and all of a sudden you feel something that was not there before. That's your heart, you know. It's a constrictive pain or a pain that is experienced like an elephant sitting on your chest, going to your neck, to your back, perspiring, diaphoresis. The other thing can come as when I used to walk a block, I had no problem. And now when I walk a block, I have some sort of a discomfort or shortness of breath. In women, it can come as fatigue, feeling nauseated sometimes, you know. After you eat, you feel a bit discomfort. This is also the signs of the heart condition. Whenever you have such symptoms, please refer to your physician immediately so that they can do the tests. Now, one thing is that we have to learn something, that there is multimodality images now that we do to diagnose heart conditions, you know. Now, we can start from the EKG. The EKG does not really diagnose, heart. 50% of the time, yes, but 50% of the time you could have heart condition and the EKG can be totally normal, you know. Then you go to echo, then the stress test, and the stress nuclear is very important where we can see the perfusion of the heart, you know. And then nowadays we have these two most important investigation modalities, the CT coronary angiogram. Without going through the invasiveness, you know, you could have your arteries seen so that you can see which arteries are blocked, which arteries are not blocked. We can know from that thing. And the last one, but not the least, is the CT coronary calcium score. Nowadays, it's very popular for any people who have significant risk factor. If you're a man after the age of 40, or a woman after the age of 55, and you have hypertension, diabetes, hyperlipidemia, even before you get a heart attack, go get the CT coronary calcium score done. Most of the insurance, they don't cover it, but all the vendors who actually have this form of investigations, they charge you $80, but it is worth it because what actually you'll get to know depending upon the score. If the score is 0, the chances are less, but you also have to know one thing, that sometimes the soft plaque cannot be shown on the CT coronary calcium score, you know. So depending upon the score, if the score is more than 100 in women and more than 400 in men, then you have to make sure that you see your cardiologist so that you can go for further testing like the exercise stress testing and prevent the heart attack. When it comes to treatment, I mean, there is a lot of treatments. I mean, number one, now there are new old medical treatments as well. There is a study that have done to show that actually the prognosis, the mortality and morbidity for people who have ischemic heart disease, if they do medication or if they go for open heart surgery or stent or anything, they are really similar. But you need to embark on this. There are a few conditions where definitely the stent, the open heart surgery, becomes essential if you had an acute heart attack or you have unstable symptoms or you have complications. When you see me in the booth, then if you have any questions, please feel free. If you have your medication, the dosages, the frequencies and everything, I'll be able to guide you. I will leave my email address as well. If you have any question that you want to ask me, or even if you see your cardiologist and if you want to have a second opinion is always healthy. At least you know that you are going in the right directions. But Muhammadin wa ali Muhammad salawat.
Wonderful. Thank you so much. Practical tips as well. So my next question is for Dr. Khan. As you mentioned, you co-founded CityMD, which revolutionized access to urgent care. In today's healthcare environment where AI, telemedicine, and retail health are redefining delivery, how do we maintain quality, empathy, and preventative focus while scaling care? And similarly, please feel free to present on your presentation.
That's a great question. Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Muhammad wa ali Muhammad. You really can't. Most of you will be surprised to know that when we started CityMD, a simple 3 to 4 minute conversation with a patient in the booth looking into their eye, they would come out and tell us that I felt like I got more communication from an urgent care doctor than I did from my primary care doctor. This is a very long and tenuous discussion, but the bottom line is the industry, and it's an industry at this point, okay? It used to be a medical profession, but it is now an industry. Because of a lot of parasitic influences that started around the time of LBJ and moving forward, it's become sort of an industry and impersonal assembly line of public health, ticking the boxes, referring out, and making sure all of the I's are dotted and the Q's are crossed so you can make sure you capture your part of the revenue cycle. This is what medicine has become, unfortunately. A lot of people don't know this. I had to learn it intimately when I had to interface with third-party payers. So to answer your question, it's really hard. It's hard to get. I mean, it's supposed to be your primary care doctor. That's the person that you're supposed to be literally part of your family, okay, and have that relationship, know you. I don't know how much that exists anymore. That's one of the reasons why I chose to do an off-grid practice without being plugged into the industry. So I didn't answer your question. I'm sorry. I'm sorry.
And then please refer to if you have any opening
Yeah,
remarks
so
too.
I was given 7 minutes to talk about what I do. So I do have 3 or 4 slides, and this is going to be a little interesting because I'm going to.
Do you want to use this mic?
Yeah, you know what? Can I get the clicker? Because I can't see my. Oh, I can see my slides there. Yeah, thank you. Okay. Yeah, it's over there.
There's one behind you.
I don't know. I feel better looking that way, right? You guys can see that way. All right. Can you guys hear me? Yeah. All right. So, SIJNY Integrated Medicine. There we go. All right. All right. So, since the early 1900s, there have been what's called, what I would say, an assault on the medical profession. Okay. 1920s, 1930s, there were several knowledge bases, which if you mastered, you can get a medical license. Okay. Structural therapies, electromedical therapeutics, pharmacology, what have you. You could get a medical license. Then, under the umbrella of protecting the public from quackery, which was true, there were a lot of people not qualified to do stuff to you, that were doing stuff to you that had a license. So they revised the process to get a medical license, and they created a curriculum. Okay. Part of the problem there was that some of what was selected to be part of the curriculum and not part of the curriculum was not driven by scientific merit, but it was driven by a lot of political and financial interests. The bottom line is that when I came out of medical school, and my colleagues as well, we had a very incomplete medical education. And this is a fact. This is not a dispute. This is just part of the historical record. So even from physiology, the physiology is a technical term for how the body works, what we're taught. And then to pathophysiology, what can I, do I have this backwards? Oh yeah, sorry. Here we go, medical education, okay, incomplete. This is a fact. So from physiology to pathophysiology just means what causes us to become sick. That's all that means, all right? To understanding that, and then to understanding what therapies are available, these come out lacking. We came out lacking. Okay, except for a very specific few scenarios, I was not impressed with what we were taught. So, want proof? Well, look at chronic disease. Okay, chronic disease, cardiovascular, immune dysregulations, neurodegenerative diseases, mental health, cancers, neuroendocrine disorders. Not only are they rising, but now they're afflicting kids at a very early age. Okay, this is unprecedented. All right. Despite the fact that you guys pay a huge portion of your incomes on medical care. You get your glossy card, right? And you're supposed to do good with it, right? Or I'm sure Sarah knows the stat. I don't know how much Americans pay per dollar for health care and where we rank in the world in terms of chronic disease. It's embarrassing. All right. Okay, so the therapeutic options, mostly pharmaceuticals. They're marketed to doctors, they're marketed to the public. You know, they seem to palliate symptoms. You know, they kind of take care of the problem superficially, but there are a lot of long-term and short-term effects of these, which are well known. These tend not to be regenerative. They tend not to be curative. And secret, not really secret, most of them don't work. Okay, most of them don't work. All right. Basically, they're based on what I would call fraudulent marketing, the way they use statistical inference and kind of show correlation and suggest there's a causation, but most of them don't work. I'm already starting to annoy my colleagues, but it's okay. I'll continue. All right. a lot of the theories, okay, so the therapeutic options, a lot to be desired. A lot of the theories that we were taught from the 1960s and 70s need revision, if not need to be completely abandoned. And I'm going to annoy Dr. Issa, but cholesterol theory, false. Coronary theory of heart disease, proven to be false. I'm not saying reperfusion is not indicated, sometimes it is, but as a primary treatment, doesn't work. Blood pressure theory, everyone needs to have a blood pressure between this and this, and if you don't, you're proven to be false, contradicted over and over again by further epidemiologic studies. Neurotransmitter theories, the spitting synapse model, disproven. Okay? Viral theories, a lot of them are disproven. So why are they still entrenched? Why are they still in textbooks? Well, that's just the nature of science and the way it kind of develops human slowness. But these are the basis for trillion-dollar industries, billion and trillion-dollar industries. Okay? So a lot more time on this, but basically, in my opinion, going through everything I went through, there were only 3 settings that I was impressed with conventional medicine. One was in the emergency room, God forbid, there's an emergency, nothing better than conventional medicine. Second setting, ICU. God forbid you're critically ill, no place better conventionally than an ICU. And the third thing, God forbid, if you really need an operation, no better place than the OR. If you need an operation, okay? A lot of operations are not necessary. Okay, now, don't get me wrong, your doctors are all very well intended. Very well intended, all right? Patients come to my office very frustrated, like, no, the doctors are very well intended, but they had an incomplete education. So what happens? Well, basically, there were a bunch of physicians through the 1940s and 70s that branched out. And they said, you know what, we've not been adequately prepared to deal with chronic disease. And they started acquiring intellectual and technical skill sets from very cutting edge independent research that was not necessarily tied into the corporate medical industry. In addition to that, they began training in medical arts outside our culture. So Chinese medicine, Ayurveda, Unani medicine. Okay, these different healing systems had a lot to offer. So they broadened their understanding of physiology. They broadened their understanding of what causes disease. Okay, factors that underlie illness. They had a deeper understanding of therapy options that not just palliate symptoms, but actually restore people back to health. Okay? And because of this, because they integrated all of these things, it's called integrative medicine. That's where the term comes from. All right. And I just want to say here, let's see, independent cutting-edge research, medical traditions from other cultures, expanded understanding, effective diagnoses and therapies, integrative medicine because it integrates. Okay, no one method has a monopoly on healing. Okay, they are all restricted in some sense of another. That's why you got to bring them together. And the science of medicine is always growing. Okay. And I will end with basically what I'm talking about. These are some treatment modalities. They have a broad range of applications, but this is a flavor for what an integrative physician would do. They would use clinically relevant dietetics and supplementation. Clinically relevant, okay? Supplementation should not be done haphazardly. You can cause imbalances just as much as you can cause good, okay? Intravenous therapies, vitamins, minerals, other agents. Detoxification is very important. We are living in a very toxic environment. Chelation therapy, which, by the way, they were arresting doctors for doing in the 1970s and 1980s. Why? People were canceling their bypass surgeries. People were canceling their amputations because they were getting chelated. Now chelation is mainstream. Okay, this is the way medicine progresses. Biooxidative therapy, systemic ozone therapy, methylene blue, European neurotherapy, which is trigger point injections in certain areas to rebalance the autonomic nervous system and foster healing. Regenerative biologics, PRP, exosomes, stem cells, these are all revolutionizing joint preservation, okay? Bioidentical hormone therapy, everyone has adrenal fatigue. I bet you 80% of this room, people have adrenal fatigue. You can't not have it and live in the modern world, but you need to address it. You need to know how to get your adrenals back online. And then there's osteopathic structural therapy, variable frequency microcurrent, electroacupuncture. And then there's direct bioenergetics, acoustic waves, pulse electromagnetic fields, scalar fields. All of these things are very, very regenerative. They restore the body. And it's been a very satisfying journey. People get well. And I'll leave you with two key factors. Okay? The CDC itself says that most chronic disease is environmental. Genetic theory has a lot of problems with it. It's basically been falsified. But of the two key factors, the environment, you've got pseudo food. Okay? The food that we eat is nutrient depleted and laden with toxins. This is not a dispute. This is well known. We've got plenty of calories, but we have no nutrient density. All right? So food has been polluted, and just as important, probably more important and not recognized, is your ambient electromagnetic environment has been polluted. The chemistry of your body does what it does because of the ambient electromagnetic fields, and they've been completely toxified for the most part. So unless you know how to deal with this, you're going to continue with your heart disease, your joint degradation, your brain fog, your depression, your anxiety, your panic attacks, your autism, until you learn how to build resiliency against this stuff. And that's what integrative medicine tries to do. Thank you.
Wonderful. Thank you so much. That was a very powerful presentation. So I'm going to ask a question, and feel free for any of our panelists to answer very succinctly and briefly. And then I don't know if we have time for Q&A. We do. Perfect. And so we'll do some questions from the audience. So my question is on the preventative mindset. So in my personal experience, I have responded to multiple different outbreaks, pandemics, and the like. And what I have seen is that, for example, Ebola. In 2014 and 2016, we had a very large Ebola outbreak in West Africa. Here in the United States, we medically evacuated about 11 patients. 3 patients were actually diagnosed here on U.S. shores. And one of those patients, I think, was one of the most amazing saves I've ever seen in my life. And that patient presented to Emory Hospital. And obviously, the COVID-19 pandemic really stressed our healthcare system to the brink. And every single one of these particular outbreaks that I've responded to, I realized that as a healthcare system, we respond so well from a crisis standpoint. We do extraordinarily well when it comes to saving a life when seconds matter. But those experiences have also showed me that our healthcare system is built to react, not necessarily to prevent. And we invest very heavily in emergency response, hospital care, urgent care, and complex treatments, and far less on prevention, early intervention, and community-based health promotion. And so my question to you all, being in the healthcare field, how can we begin to shift our healthcare system from becoming reactive to truly preventative and, basically focusing on prevention and keeping people well in the first place before we hit that crisis, level? So if anyone wants to take a couple of minutes to answer that question, please feel free to do so, and then we'll open it up to the audience.
Yes, that's a really good question. So we really don't have any public health. The public health measures that we have, I'm sorry, are not very effective. If we really had public health, the first thing that would get cleaned up is the food supply. Now, Syra and I probably disagree on the viral model of a lot of these diseases, but what is, even the viral proponents will say, it's not just the virus, it's the host. The host has to be sufficiently susceptible for the virulence. So under that model, if you're healthy and you're resilient and you're nutrified, you're not going to get hit as hard, assuming you believe in the whole viral model, okay? So we have no safeguards in our nutrition. So the first thing I would do is I would literally outlaw a lot of the way foods get to the shelves. So that's one thing, okay? So that's a huge public health measure. Just doing that alone would be preventive.
Yeah, I think you reach a good point, and I'll just quickly mention when we talk about what causes infectious disease, right? You need the host, right? The host is obviously an important factor, the state of the health of the host. It's the actual microbes, so what are the properties of the virus, the bacteria, and the like, and it's the environment. And when all three of that trifecta come together, right, that's when you can have an individual that can get infected. So all three obviously play a significant role. I think you were going to add something?
Yes. In terms of preventing falls, especially because that's my topic, and I see a lot of geriatric population, and there's multiple hospitalizations. I think the healthcare workers and the doctors here may agree that the maximum number of visits in the ER are secondary to the falls at home or on the street or anything. And these are usually patients that are above 65. Again, just to reinforce that you don't have to be very sick to have an imbalance, to fall. You could be wearing a very huge abaya. And I know somebody so dear to me that, she's in her early 60s and she had a very bad fall because she was wearing a very long abaya, So you want to be mindful of what you wear and the kind of shoes you wear. If you're using an assistive device, you want to make sure you're using it appropriately, and your healthcare practitioner educates you on the proper usage of it, And if you feel unsteady or you feel like you're going to have, you're afraid of falling, that's one of the first signs that, I would say that, lack of physical fitness, it could be coming from an illness. So I think people that are physically fit, people that are mobile, regardless of their environment, are some of the people that, are prone to avoid the chronic conditions followed by falls, Multiple deaths happen because of hip fractures, Not many can survive more than a year after a hip fracture. So this is something very serious. I think once a person realizes is more aware of their environment and physically how they feel, and do screening appropriately, timely, I think that a lot of things can be avoided. So that's my 2 cents.
Yes. And we'll take audience questions right after yours. Yeah.
Okay, so I'll say, I think that on a broader level, when it comes to mental health, it can start in the schools. I can speak for myself. Growing up, we didn't have a lot of conversation in our school system about emotions and boundaries and space and things like that, but I'm seeing that a lot more in our school system, especially in my children's schools. And so there's a lot more self-awareness and the emphasis on self-awareness that's happening at a young age, so I'm hoping that that can continue. But I think it needs to move beyond just a checkbox that's happening in the school system as well as our pediatricians' offices. We also need to emphasize a link between self-awareness and action. So it's one thing to be aware, and it's a great thing. If we can be aware of when our body is in a great space, no matter what's going on, then we'll be aware of when it's not. And then, of course, being able to emphasize the skill of self-awareness and linking that to some kind of intervention. When it happens on an individual level, institutional level, and then hopefully a more broader level.
Wonderful. Thank you so much. Is there something you want to add? Yep.
I just want to add, prevention is better than cure, definitely, And my friend told me about the medication which we use. I have experienced, from the past 30 years, when I started cardiology, I would see many patients with acute heart attack, acute MI, But since the introduction of the statins, where it reduces the cholesterol to the level which we want, like 50 to 60 in patients who are diabetic or significant risk factors, believe me, we hardly see them now. It takes another month or two in the emergency room before we are called the patient with acute. And those patients who comes with an acute MI, if you see their cholesterols are way out, So I have a feeling that I know one thing, whatever he says is right, probably right, but there is some element that these medications that definitely help to prevent you from having acute MI or acute heart failure, and these medications are really helpful. This is what I feel, but let's see.
Sure, if you could take a minute, yep.
Sorry, I just want to address your question one more time. The other thing is the electromagnetic environment. People don't understand this at all. And, I make a joke. We used to laugh at the Romans for using lead in their plumbing. Look at those idiots. They use lead in their plumbing. I'm not joking. That if humanity is around long enough, there will come a time where people would literally laugh at our civilization for using contaminated forms of electricity running through wires and using basically microwave radar waves, just for convenience, okay? You want to talk about, public health measures and being proactive. It is a fact. This is in the medical scientific literature, people. The medical industry literature takes from the medical scientific literature what it will and then doesn't certain things. But if you go to the medical scientific literature, it is a fact, not disputed, that wireless electricity, radar waves, and dirty electricity cause immune destabilization chronically. Chronically, okay? She talked about the schools and mental health. I know people that mitigate this stuff and get rid of it, okay? 2 cases I'll tell you. One case, one classroom was cleaned up. The ADD class stopped being the ADD class. Okay? Neurophysiology requires what's called synchrony of the alpha wave. It is known, it's not a dispute, that all this electromagnetic man-made stuff causes a desynchrony of the alpha wave. It's not a dispute. And people, oh, why do people get depressed? I mean, it's so obvious that until you address the physiologic stuff, you have to rule that out first before you dive deep and say, hey, were you, fondled as a child or whatever. You have to rule out the physiologic stuff first. Okay? I know many psychiatrists that have abandoned this. They say, unless you correct somebody's hormones, clean up their environment, don't bother putting them on a med. Okay? So, it's just preventive stuff for free immune system, EMFs.
Question over there. So, yeah, please feel free to stand up and pose your question.
Thank you so much. Assalamu alaikum. So nice to see everyone. My name is Sadia Cheshti. I'm a gastroenterologist, and you talked about preventive measures, so I felt compelled to just say hello to all my brothers and sisters and tell you to please get your screening colonoscopies. And this setting is so familiar to me. I'll share how I was personally affected by it. I was living in Pennsylvania. I was in private practice there for about 10 years, and our imam, his wife, was my Arabic teacher. Alhamdulillah, beautiful, lady. She was just 40 years old, and having bleeding per rectum is kind of embarrassing. She never shared it with anybody. And by the time she was diagnosed, she had advanced colon cancer and passed in her early 40s. And so we're a community of dignity and privacy, and I get it. It's hard to share personal things, especially for my brothers. It's not a typical thing to want to talk about, but please do the preventive measures. Get your screenings. If you have symptoms, don't ignore it. Let's catch liver disease early. Let's catch colon polyps early so we prevent issues. If you're getting chest pain climbing up a flight of steps, it's not gas. Get yourself checked out. Get yourself to a cardiologist. And inshallah, I look forward to our community getting more updated on having a better environment, having better nutrition. But for right now, with what we have, with the fast food and the fast life, we have to kind of deal with that, and in the long term, make improvements. So thank you so much.
Thank you.
Assalamu alaikum.
Yes, shout out for early screening. Thank you so much for that. As we wait for any additional questions, I'll pose another one to our panelists. So when we talk about prevention and well-being, it's so important to remember that the body doesn't operate in silos. It's a holistic system where physical, mental, and emotional health are deeply interconnected. You can't address heart without considering stress and mental health well-being. You can't treat pain without looking at mobility, sleep, and even social support. So we'd love to hear, and I'll just ask 2 of you to share some successful examples of cross-specialty or interdisciplinary approaches you've seen that truly embody this holistic model of care. And so any 2 panelists would like to take that question, please feel free to do so, and then we'll see if there's additional questions in the audience.
She was asking.
So from a cardiology standpoint, anything that you want to share from a interdisciplinary collaboration approach? So the question is more on cross-collaboration, so looking at the body from a holistic approach.
From the cross-collaboration?
Yes.
Oh, okay. It's a difficult question, very difficult question. But nowadays, you're talking about the insurances and everything, correct? Yes. You're correct. Yes, yeah, of course, definitely, yeah. I would say one thing, you need to take care of the whole body, You need to see your if you have any psych problem, you have to go to your psychiatrist. If you have any what the medical problems you have to see your internal medicine doctor. And if you have any heart problems, then of course you can come and see us. But you definitely have to be treated as a whole body. I mean, definitely.
Sorry, I think I know what you're getting at. So I'll tell you about strategy, and then I'll give you a couple of cases, okay? So the first thing you got to do is you got to fix depletions, nutrient depletions, okay? All right. Next, you have to detoxify the body, okay? Then you have to use energetic and, if necessary, pharmaceutical means to bring the system online, all right? So that's sort of like a holistic approach, no matter what, okay? So I have a gentleman who was told, she was told she needed a knee replacement, because the knee replacement is a huge industry. No offense to my orthopedic colleague, but there's really no attempt to preserve the joints. They just kind of shoot. Oh, time for your replacement, and boom, cha-ching, right? That is, all orthopedists understand this. It's not financially rewarding to try to preserve joints, okay? So she was told by two HSS and another orthopedist that inevitable, right? That's the joint inevitable. So she came to me tearfully. I put her on what's called, so the liver is very, very intimately tied to the knee joint and the hip, okay? So she went on an aggressive nutritional and detoxification protocol aimed at cleansing her liver. And there's ways to do that orally and even rectally, but orally, okay? After that, I found and she started feeling better. She's like, oh my God, now I don't have pain at rest. I only have pain when I exert, okay? Then I found out, and I should have asked this sooner, that she actually had a root canal in her canine tooth. Now, for those of you who know meridian physiology, all meridians and fascial cybernetics run through teeth, okay? All right, and where's Batul? Where's Rizvi? Is Batul here? Yeah. She's seen this. I've shown her video of my cases. So I temporarily injected her root canal. There's a procedure you can do to take it out of the circuit of the body's cybernetic system, just temporarily. And she started crying. She gets up, she walks around, she squats, she says, I have no pain. Okay? I said, don't worry, it'll be back in about half an hour. Because it'll start. But there is an example, okay? I would have gone for PRP and stem cells in her, but I didn't have to. She got her root canal out, and guess what? She's pain-free. She doesn't need a knee replacement, okay? I've seen this with shoulders. My cousin is the ICU chairman at NUMIC. He couldn't do namaz. He couldn't bend his knee. I was putting ozone into his knee. Went from a 10 to about a 3, 4. I wasn't happy. He had a root canal on the first molar. I injected that. He's like, oh, my God, my knee's not hurting anymore. He still hasn't gotten to remove it because he's happy enough with ozone. But the point is, this is an example of a holistic approach. Cardiovascular disease, same thing, by the way. I think you may know there's a huge dental cardiac connection. So see Batul, she gets this. See Batul, she understands this oral systemic connection.
I love your, integrative approach, and would love to see some of the studies and, the evidence of many of the theories that you've posed. I think those are important, but love to kind of see some of the data behind that. Any additional questions from the audience?
We have one last question
Perfect.
over here, and then we'll wrap it up.
Thank you. This question is for Dr. Khan, Integrative Medicine. I'm interested in finding out how you learned about this. What courses did you take? And is there scientific research ongoing to prove this theory? And number two, do you have any experience in treatment of long COVID?
Yes. Long COVID is adrenal fatigue until proven otherwise. It's a neuroendocrinopathy. I will tell you my last case of long COVID, a 22-year-old male who was having daily fevers, fatigue, brain fog, could not function for 1.5 years. 1.5 years, okay? Went to all the ID people, went to the naturopaths, went to the chiropractors. The only thing that would temporarily block his fevers for a couple of days was systemic ozone therapy, but then he'd be right back. So what I did with him is I did an aggressive, so I used ozone, special IV drips, methylene blue to kind of rescue his what's called redox or inflammatory state, okay, and his fever stopped, okay? Then I found out he was in adrenal fatigue, so did an adrenal rescue, and did what's called transcranial magnetic resonance. That's when you, it's called neuromodulation, when you bring the alpha frequencies back online. And for the past month and a half, he has been fever-free and now is hanging out with his friends, okay? So this just gives you, but you have to sequence it properly, okay? They were giving him ozone without addressing the adrenals. If your adrenals are on fumes, you're not going to be able to hold anything. Okay, that's why the ozone was only temporarily working. So there's a sequence of events. And of course, I had to put him on supplements. He was on, I don't know who he saw, what naturopaths or chiropractors, he was on just a slew of supplements that were at cross purposes with his metabolism. By the way, he was built to be a carnivore. All right, I don't know if you guys know this, but some people are built to process animal protein and lipids as their primary source, okay, and other people's are the opposite. They're more grains and vegetarians, and then there's in between. He was actually built to be a carnivore, but because he was on the spectrum, he avoided meat. So I had to put him on supplements that were heavy in animal protein and calcium, and very minimal magnesium and potassium. Too much magnesium and potassium in these people, it causes them to This, by the way, is unani. You guys know unani. You know, the mizaj, the dietetic, medicinal properties of dietetics, right? So you have north, south, you know, hot, cold, and all this. So they understood this. This is being rediscovered by modern medicine, the dietetic, medicinal properties of dietetics.
Question, and I will just add, there is certainly a viral component to long COVID, of viral remnants. There's many peer-reviewed scientific studies that have shown the causes of long COVID and some of the ways of treatment. So with that, I want to first thank my amazing panelists here today for sharing their insights and knowledge with everyone here. So thank you all so much. Can we give them a round of applause, please? Amazing. Thank you. So with that, I'm going to hand it back over to Shazia, and thank you all so much.
Thank you so much. At this point, I was going to take a moment to introduce all of our booth volunteers. However, I am reading the room. I think this is not the right moment to do that. So suffice it to say that you're going to have a little break after this to go around and meet all of the fantastic professionals that have volunteered their time. Make sure to go to each and every booth. They have some giveaways, and then they have a lot of information that you can talk to them about one-on-one. I heard over here some rumblings of individual questions, pacemaker, etc. Speak to the professionals directly at the booth. Before you head off for the snacks at the back, I wanted to mention that there were many people who were here with us last year, and they are no longer with us today. The Fatiha at the back, the chai, the snacks, all of that was donated in memory of marhumin. So let's all recite Surah Fatiha for all marhumin. Bismillahirrahmanirrahim. Beside the Fatiha that has been provided by Masjid, Sister Nadira is also selling some mix that you can go and enjoy. And I will just call Sister Ruhaina up to do a couple of raffle prizes for all of those who filled out their raffle tickets as you walked in. Okay, here you go.
Assalamu alaikum, everyone. Alhamdulillah, we have such a great turnout. We love it when you guys register ahead of time so we know what's the age range, what's the gender, what are the topics. So we want to say thank you so much to Maryam Tejani. She was the first one to register. So can we give her a loud salawat? And I feel like it was your son who did it, so please tell your children to register for you. That's great. We are going to give you a Theragun for your prize for signing up to be the first. So inshallah, someone else will get this prize next year when you guys register early. We have a scalp massage, and these are only for people who registered ahead of time. So if you showed up today, we have a different raffle for you. But Ghulam Abbas Dinani. Oh, okay, so we're going to call someone else. Shirin Kalfan, you get a scalp massage. Here we go. Tahira Habib. Oh, okay, fine. Tahira Auntie. You get a hand grip. It's going to be good for your physical therapy needs. And this is going to be the last one. 2-pound weights. Zara Hassan Ali. There you go, Shazia. All women. I guess the women registered before the men. Inshallah, the next round will be for men.
Tell them we have more.
We have a lot more raffle prizes. So we have neck pillows. We have more weights, back massagers, heated. Yeah, we have a lot. So inshallah, next round.
So they get about a half an hour break. Okay. You have about half an hour to walk around, eat some food, stretch your legs, and then we're back for another fantastic panel. For those women who are going for the mindful yoga for busy women, please meet Ruhina and she'll take you to the room. Okay, time for some more raffle prizes. Please take your seats and let's see who's gonna win something next.
No, you're okay. So, we're gonna go for a hand grabber. This is great for seniors who need to reach something at the top of their shelves. Munaza Mustafa? Do we have a Munaza? All right, we'll pick someone else. Mazahir Tejani, I know you're here. You get this? It's going to be for your mom to reach from the top. Your mom is the lucky winner today.
I feel like I should call him up to receive it.
He's too young. We have a neck pillow for all your wonderful travels when you guys are leaving for out of town. Let's do this. Muhammad Habib, Mikey, we see you. We're going to get this to you. Shazia, Mikey. Yeah, Mikey. We have 2-pound weights. These are great to put on your wrist while you're walking and things like that. Shamim Alu, Muhammad Hassan's mom. She's here. Yeah, she's probably here. Muhammad Hassan. Give it to Aziza. I saw Aziza.
I see her
Aziza's
over
right there.
Yeah.
We'll put this back in. She already got that first gift.
No, it's okay. She won it. It's fine. I promise. I have another one. We have a heating pad. Rehana Jaffer, you get a heating pad. You and your granddaughter. Heating pad for you, for all your stress that we give you. We have a water bottle. Fatma Jaxi.
Maybe she's in the
Yeah,
chair yoga.
Habiba's.
Yeah, I saw her. She might be in the chair yoga.
Yeah, that's fine. Here, you want to just put it? Yeah. I saw Habiba went to chair yoga also.
Okay.
Finger grip and strengthener. Rahman Mitani. Is Rukaya's, yeah? You won something. I wasn't sure who it was. It's to strengthen your grips.
Thank you.
There you go.
Thank you.
Last one for right now is also to reach high things. Auntie, you won something. Shazia's going to give it to you. You won something in the raffle. Yeah, you. This guy's coming up 5 times. I've seen it. Anisa Remdullah. I know she was in line to get a massage. Perfect, we're done.
Okay. Fantastic. Okay, I will give you 30 seconds to get back to your seat so that we can begin the next session. If everyone at the booths can come and take a seat, we're ready for our next session to begin. This next panel is going to be fantastic. It's been months in the planning, and you're in for a real treat. Please, let's take our seats and give our panelists all of our attention.
I don't think it's been months. She said it's been months since you vanished. Oh boy.
Somehow the stars aligned. This next panel is entitled Preparing for the Journey, Faith and Family in End-of-Life Planning. For today, our moderator is going to be Dr. Zamina Aziz, and as you know, she's no stranger to this audience. Dr. Aziz is an internal medicine resident at Northwell Health, Lenox Hill Hospital. She's also a clinical ethics fellow at Northwell Western Region. If we can welcome her with a loud salawat, she will introduce us to her panelists. Allah.
This is mine then. All right. A'udhu billah. Oh, can anyone hear me? أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. I guess we're competing with yoga and massages. So no one really wants to talk about death, and I totally understand that. Can we just have one big loud salawat ala Muhammad wa ali Muhammad?
Allahumma salli ala Muhammad wa ali Muhammad.
And one more of your loudest salawat ala Muhammad wa ali Muhammad.
Allahumma salli ala Muhammad wa ali Muhammad.
Bismillah ar-Rahman ar-Rahim. I know I'm competing with sports and yoga, massages, jai, lots of good stuff. And so a panel about death feels like the last thing people want to pay attention to. So I appreciate everybody's time today. Assalamu alaikum, my mothers, fathers, brothers and sisters in the community. It's my pleasure today to host what I would like to be a very casual fireside chat, like a podcast style talk with Sister Nzinga Abdullah Aziz. She is a nursing educator and founder of multiple organizations, including Compassion Wellspring, a holistic education and consulting initiative that integrates faith, wellness, and emotional intelligence. She was a previous hospice and palliative care nurse and has experience in both hospital and community healthcare settings. And she also is from Washington, D.C., spent some time in Hausa as well. And it's my pleasure to welcome her today from all the way across the Amtrak. So, Sister Nzinga, today I'd like to just have you introduce a little bit about yourself and your work in hospice and palliative care and the kind of education work you do now. And then we're going to facilitate this discussion into 3 phases. I had the honor of doing this with my dad last year, so I miss him a lot. We did a case at that time, if any of you were here last year, talking about a very similar issue. And today will be an extension of that discussion, so we won't repeat a case. But we'll try and integrate different stories, and inshallah we'll have a poll. So for the first 30 minutes, we'll have a conversation about end of life and what that looks like, and how we can prepare and think about very difficult advanced illness states. And then at the end, for the last 20 minutes, we'll have the audience come in with questions in an anonymous fashion so that we're hopefully answering maybe some of the things that you've thought about or maybe didn't want to voice in a public setting. So that's how we'll lead today, inshallah. So Sister Nzinga, tell me a little bit about yourself.
Bismillah ar-Rahman ar-Rahim. Let me first begin with a dua. Allah, please bless Muhammad and his family and spare me the concerns which distract me. Employ me in that about which you will ask me tomorrow, and let me pass my days entirely in that for which you have created me. I start with this piece of a dua from Karam al-Akhlaq because it really highlights how the things that we're doing today impacts our tomorrow. And it also, the reason why we're doing those things in relation to seeking our path to our Creator should impact every decision that we're making today. So I'm a nurse, and I've been a nurse for about 20 years. That's probably not the most important thing that I do, but I'll start there. The work that I do right now really centers around being available for my community. So that's within the nursing community as well as within our Muslim community. And what I'm interested in is being part of conversations and providing education and frameworks that help us develop the language and the thinking, the vocabulary around talking about death and end of life. And the key to that is that it will inform how we live our everyday. It'll inform how we prioritize, it will inform how we make our decisions, and it'll inform how we behave in our relationships. So this is what has become a work of passion for me in having these conversations, not only with people who are older, which seems to be the place where we're comfortable, maybe more comfortable to think about death and dying, but really, Allah tells us in the Quran that kullu nafsin da'aqatul maut, and that every soul will taste death in Surah Al Imran, verse 185. And so for that, we know that there's no promise of any specific time or date, and it behooves us as wise believers to be prepared.
Beautiful, thank you. And I remember with our phone conversation prior to this panel, and I'm going to face you, so at least we're not intimidated here. But I remember when you first talked about why you got into hospice medicine and what brought you in was also your experiences, both personally and in the community, of interacting with people who have been in very difficult illness states. And I know we talked about that together in terms of what I see in the hospital and in the community and what you see in your work as well, and how we're often thrown into end of life when it's at its very worst, when there's chaos. And I know from my work in ethics, at least, that's when everybody brings in the ethics team to figure out, what do we do when, we're feeling like the doctors aren't listening to us or the patients aren't, listening to us, and no one's listening to each other, and somebody in the background is incredibly sick and suffering as a result. I wanted to know if we could go back to that discussion, and if you could tell me maybe about one or two stories that really influenced and showed you how we think about dying in our community.
Sure. So I'll tell you a story from my hospice work. Hospice is a part of medicine that is engaged when a person has a limited life expectancy. So if doctors and clinicians feel that a person maybe is within the last 6 months of their life, then hospice services might be invited in. And those services include a team, it's an interdisciplinary team of a nurse, chaplain, or spiritual counselor, social worker, physician, nursing assistant, that all work together and collaborate to provide care. The recognition is that a person in that phase of life has really specific needs. They have spiritual needs, they have social needs, they obviously have medical needs, and this team works to support the family in caring for them. I found a real home in that space because it was a space where the spirituality of the individual and the whole person was recognized and acknowledged. And I didn't really see that in other parts of medicine and other parts of nursing. The story that I can share with you is a woman that I met when I went to a home. So when I'm going to a home, I wouldn't know who I'm going to meet, anything about their background. But this particular woman, this is a heartwarming example I can share. She was elderly, she had a very serious diagnosis, and she'd received treatment and she'd gotten a maximum benefit from the treatment. She'd done what she was supposed to, what she wanted to do, according to her values. She had never married, she didn't have any children. So this sounds like the beginning of a really sad story, right? She never married, she didn't have any children, she didn't even have any family. She was from Europe, she had an accent, she'd been here for a couple of decades. The people who were caring for her as her decision makers, they were her friends from 20 years of work. They were her colleagues and her friends. So she'd had advance directives signed, she had her will in place, and she had all of those things in place. She'd set aside some money, so she had a certified nursing assistant who was there caring for her and tending to her personal needs. But what was beautiful and heartwarming about this story is when I entered her home, the hospital bed was set up facing a window. She loved watching the birds, and she'd been an avid bird watcher. So while she couldn't go on trips and travel and do it in the way that she was used to, her family had the presence, her family that was caring for her, had the presence of mind to position the bed so she could look out on the patio and watch the squirrels and watch the birds come and eating different snacks and treats and so on. And this was a serene picture. She had spoken about what was important to her. Being home was important to her. Being cared for was important to her. Getting treatment was important to her. And when it was very clear that the treatment was no longer effective, choosing to focus on adding as much life to as much time and as much quality to the remainder of her life became important to her. So while in the beginning of that story it might have sounded kind of dreary and sad, I want you to see the arc of the entire story and how really she was able to achieve something, and she had an accomplishment in that. And her friends felt success in that they were providing care to her in a way that was meaningful.
I think that's a really beautiful example of death as an achievement. And that's a very spiritual concept as well in our Shia faith tradition, in that Imam Ali alayhi salam talks about death being a gift to the believer. And there's this idea in our faith tradition as well of a good death. You know, Hazrat Qasim said, you know, death to me is sweeter than honey, because that death that he was, you know, going towards was a death where he felt that I was on the path of truth. Yes. And I think it's really interesting because when we see people in the hospital and when we have these conversations about end of life, we always ask our patient, you know, what matters most to you? And that's part of the geriatric assessment. It's part of the end of life assessment. And it should also be part of our own spiritual assessment of ourselves as well, I think, asking what matters most to us. Because sometimes I think we get it wrong.
So, you know, this idea of a good death is an idea that comes out of phenology literature. It's an idea that, you know, sometimes people put these two words because death is ultimately considered in secular culture to be bad. So to put good in front of it, it's kind of like introducing somewhat of an oxymoron. But the idea of a good death, from the person who originated like the term, Dr. Edwin Schneidman, he says that there is no single best kind of death. A good death is one that is appropriate for that person. It is in character, on camera, and ego-syntotic. And what he's just saying is that it's not defined by medicine. He says it shouldn't even be defined by religion or culture, but rather it should be defined by that which fits the individual. So the story that I just told was this woman who defined it according to what fit her most. And it's consistent with the individual's character, it's consistent with their beliefs, it's consistent with their way of being in the world. We die as we live. And that's what a good death is defined as. And it allows a person to remain who they are all the way up till and through the threshold of crossing. So I love that definition because we are able to take that definition and extrapolate from it according to our Islamic ethos. So I'll tell you another story. I think I am a storyteller. It's very much part of nursing that we tell and teach through our stories. And so my mother passed away from pancreatic cancer in 2020. May she rest in peace, and please say a Fatiha for her. So her name is Aisha Al-Mekki, and she was a teacher, she was a community activist, she was a mother and grandmother. Those are some of the roles that she was most happy with. We organized in our home. My brother would come over. I took off time from work. I went on leave from work. And I was really happy. She'd supported me through nursing school, so I'm like, this is the ultimate payback, mama. And so she, my family all wrapped around. One of my brothers came over every day at 4 o'clock and was like, you leave, I'm here, it's my turn. And he stayed until later that day. It became this kind of event where my mother was able to engage in the way that she had lived. So she'd been a teacher, so she had lots and lots of students, right? And we created a space, even in pandemic time in 2020, to safely allow her to have the visitors and have receive the love and give the love that she had practiced doing her entire life. This is how we kind of pictured what a good death would look like, but most significantly, we responded to what her call was. For her, even in the pandemic, it was important that she see people and be able to give and receive love. That had been her ethos of what her life was about. Her heart beat for the children that she taught, her heart beat for the community that she served. She did want her pain to be managed. She was told me, I can't do the pain, you know? And so she had a Dilaudid, a painkiller, a very powerful pain medication. So she had that in a PICC line. So she had that in a patient-controlled anesthesia and a PCA pump. So she was able to control that. So our friends were involved, family was involved. There were lots of opportunity to say farewell to the community. So to me, she was able to have what we define as a good death, and because it was defined by her. And I think if I had to distill it into like 3 ingredients, I would say that a good death should be composed of truthful communication, comfort-focused care, and spiritual orientation. Truthful communication is essential because if we don't know that death is on the horizon, we can't talk about it and have the conversations that we need to. And I invite all of us to develop a greater level of comfort with that knowledge. because it is there. It is constantly, constantly there. And while we acknowledge on our tongue that reality, often it is in practice that we really fail to bring that into fruition into our actions. Comfort-focused care is because people are afraid. They're afraid of being in pain. We know about pain, but really, Sister Dr. Aziz can confirm for you that some of the most common symptoms are not only pain. You can have debilitating nausea that every time you try to move, you can't move without having debilitating nausea and you're going to vomit, right? Constipation, diarrhea, trouble breathing. These are all severe anxiety, delirium. So these are all symptoms that can happen regardless of a person's diagnosis as they approach end of life. So comfort-focused care is the other one. And spiritual orientation. We have a very rich, I could weep with tears of joy and appreciation for the traditions that our Ma'sumin have given us and for the way that they lived and how they practiced and how they greeted and even embraced death. When we talk about Imam Hussein and we talk about the way that they prepared the night before, that they knew they were going to die. You just mentioned Hadrat Qasim. And so we have these very, very clear examples of how we should greet and embrace. And we really do struggle. And I can talk about that some more.
Yeah, I would love to. I mean, just to summarize, I think that's a very interesting definition you've brought. The question was, what defines a good death? And I think you had one anecdote and then also your mom's story, which was very powerful, distilling it into truth and communication, truthful communication, comfort, and so like the way we manage, the experience of pain and the experience of dying from a medical perspective, but also the spiritual element, so how we think about our suffering and how we think about our end, and thinking about it as a transitional point. And I think it's a wonderful, and it's interesting as well, this idea of an individual death, and I wanted to or an individualized perspective on this, because we do all end up in our own graves as individuals, yet the experience of death is one that is communal. It is one that is influenced by what our families want, what our families have guilt about, the emotions of our community, the emotions of our kids, our parents, our siblings, both positive and negative. And so on one hand, I think we can individually prepare and think about what a good death might look like. But how do you think about that in the communal way that we all live our lives here?
So I think that has to begin with a really healthy dose of courage and introspection. So we have to be willing to confess to ourselves where our fears are and why they are there. I think it feels, maybe during Muharram and maybe in the different shahadat that we bear witness to when we mourn and we grieve, it's other people. It's over there still, as much as we love our Ma'sumin. But when it comes and it's here, and it's us, and it's my mother, and it's me, then there can be this kind of cognitive dissonance where I think sometimes we've educated our ways out of being as fully spiritually present as we should be. So that healthy dose of introspection and honesty with ourselves is where it must begin. What does it really mean when you think that I'm going to take my last breath? All of this stuff that I've worked for, all of this that I've built, all of the things that I did not resolve, all of the things that I have created and made, the mistakes that I made, all of my regrets, all of my unresolved issues, all of my guilt, all of my shame, I'm going to be unable to do anything about those at some point in time. And what exactly does that mean? Because I think that the place where we get this kind of this clash is that within ourselves we're uncomfortable, and so then we can't have an honest conversation with anyone else. My father, may he rest in peace, Brother Yahya, he passed away in 2022. Please say Fatiha for him. He so the next part, so one is being honest and listening to ourselves, but then the next part is listening around us. And so I'll tell you a story about my Baba. He was from South Carolina, and he would go to different funerals of his family over the years. So from Philadelphia, where we lived, to South Carolina, it was like 10, 12-hour drive. So he'd go and he'd drive down there, sometimes with other family. I did accompany him a few times. But on the way back, he would call me. Nzinga, here's what you're going to do. Here's what you're going to do for me. Nzinga, here's what you're not going to do for me. And he would call and he would tell me. So we listened very carefully. And over the years, like over decades, this happened. And I just be like, yeah, Bubba, oh yeah, that was terrible. Oh yeah, that was nice. You know, and I just listen, you know. And then like, so by the way, you're gonna get my car fixed? Like, I mean, just, you know, the things that Bubba's do for their girls, for their kids. And then at one point it occurred to me, because I'd seen him and he had a little more gray hair than I remembered. And I was like, oh wait, he's telling you something. He's giving you some really valuable information. So I started to listen differently. So we talk about this active listening. If you look at therapeutic communication and communication, if you look at anything about communication, especially as a clinician, there's this term active listening that's brought in. So I heard this other term that I kind of like even more because it feels like I can feel it in me more, and that's deep listening. Deep listening for me is go beneath that top layer and then peel the next one back and then peel that next one back too, and now listen to what is being said. So what Bubba was really saying is, here is how I want you to love me when I die. That's what he was actually saying. So I was able to learn to listen for that, and I actually started a note. And I was like, Bubba's funeral, and I started taking notes down. So kind of to that end, when my father did pass away, one of the things that he had complained about was he was like, people who come to my funeral cannot wait in line for food. That is the ultimate disrespect. It bothered him for every funeral that he went to. That was one of the things that he would talk about. So I literally had on my list, no people waiting in line for food. And so something that benign or that simple, but when it was time, we rented a really nice place. We made sure that everybody was served, you know, and anyway, we made sure that nobody waited in line for food. But that's just a small thing. But one of the other things that he said was, you know, I want my non-Muslim family to understand what's happening. I want them to understand what the rituals are. I want them to feel included in this burial process so that they can have an opportunity to grieve and not be alienated by the Muslimness of the burial process. And sure enough, when I saw my uncle Ronnie, who was the last surviving sibling out of the 10 of them, I told him, I started explaining to him, we're going to do this prayer now. You know, we're all going to stand and we're going to face the direction of Mecca, and Baba's body is there. And I kept explaining it to him. I was like, now, if you want to sit over there, there's some chairs. And he was like, oh, no, I'm standing here with you. So he stood there with us, and he held his hands, and he stood right by us because he wanted to pay tribute to his brother, to his big brother, and the way that his brother had found meaningful in that faith. So those are just two things. Yeah.
That's beautiful. May your parents be with the awliya of Allah, inshallah.
Ameen.
Ameen. I think it's beautiful when you talk about spending time in funerals, that your dad actually went to funerals and he's doing his audit and commentary. And sometimes I find that sometimes we anchor on the specifics in order as also a fear-based response. That, you know, I want bajia batata at my, funeral, or I want chevro, because anchoring on the specifics of what we like in this world helps us remember that we will no longer be in it. And so I sometimes find that my patients and my family members and community members will say very specific things about, oh, I didn't like this or I didn't like that, thinking about a funeral the way they think about birthdays or weddings, because it actualizes it for them. And it's also a fear-based coping response that we think about, what does it look like to have an event where I'm no longer there? And so that's a very active communal process of us thinking about what we want. And it's also important in the ways that we think about legacy. And I think our awliya and, our aimma have also talked about this in this idea that death is not a separation from this world, or it should be a welcome separation, but rather a uniting or a dissolving with Allah subhanahu wa ta'ala, or reuniting. And I think also reframing that perspective of death, I think, is really important, and asking ourselves how we enter that unification process. I want to switch and, also pick on something you said here, which was that your Baba told you all of this information as the daughter.
Yeah.
And I sometimes think in our community, when we talk about end of life and when we talk about, advanced illness, that conversation and the burden of caregiving or the pleasure of caregiving sometimes does fall on the female members of our community. I wanted to know if you could speak to that as your experience, in nursing, but also in the personal stories that you've witnessed.
So, the nature of every relationship is different, right? We can have many children, and the nature of a parent with each one of their children would be different, while there's love in each one. And so the nature of even a child with their two parents will be different. They love their mother and father equally if we had to go and measure it somehow, but the things that they'll talk about with each parent are going to be distinctly different. So this can be true for friends and other relationships as well. So that's one thing. Another thing is due to so one part of this conversation is kind of I think part of it is nature and the nurturing nature that women have, and that, for me personally, even with my medical background aside, me and my Bubba, we would talk. He was chatty, I was chatty, and so that's why he knew he could get me for a couple hours of those 12 hours on the way back from South Carolina. And so there's that. But caregiving is one of the it's one of the most amazing and beautiful things that we can do for one another. I mean, in essence, that's what mothering is, right? It's like it's pinnacle of caregiving, where that being is within one's body at some point, and then attached to them for 2 years while they're nursing them, and then so on throughout life, and for their fathers as well. So there's this pinnacle of caregiving that happens there, but it's a core part of our relationships. Now, when it comes to these specific nuanced conversations, and when it comes to who's carrying out the work, things are challenging. Things are really challenging. So I told you how my brother, he would have his work day, and then at 4 o'clock every day he came. I now when I think back, I'm like, I don't know how he did that. I wasn't working, so I was there, right? But every day at 4 o'clock I could I could count on him to walk through the door, and I could count on him to be there. And what he did for my mom was different than what I did. And sometimes his wife would also come, and there are other siblings that came and did different things. But that reliability in him showing up was really meaningful, and it was meaningful to my mother as well. The world has changed a lot from the time where, sometimes we have memories of how things were once done. And the world has changed a lot from just the last 100 years. So, just the last 20 years, just the last 30 years. And sometimes we have these legacy stories of, I told you, I said, when I was growing up and we'd go down to South Carolina, there was always some old lady in the corner, some old man sitting on a porch. They were an uncle, they were a grandma, they were a grandpa. One of the first pictures that I have is of my father's grandmother holding me, looking out on Myrtle Beach in South Carolina, right? I can't imagine. She had to be at 100, So there was always this image of this person. At that same time, there was always a person who was available for that caregiving. But as our societies have moved and advanced, and there are many things that we celebrate about these advancements, but we have to go back and revisit our community agreements about who does what. So we're very proud of our women who are working, and did you see the panel a little while ago, right? They're also all caregivers, right? Being at the helm of any CEO organization or running any hospital or major, none of those interferes with the caregiving duties that these people have, that these women have specifically. So I think that we have to go back and reevaluate the ask and reevaluate the expectation. If what we remember our grandmothers doing, what we remember our great aunts doing, just logistically isn't always possible by comparison to what is happening today, just in the number of hours of the day, the number of tasks that are held. And so I also come from a home care background. 10 years before, I've been a nurse for 20 years, the first 10 in home care. I love home care. I think there was someone here, there was a home care agency here today, I think I heard. Yeah, home care is amazing. To the extent possible, I think we should resist institutional care at most levels, but home care gives a person an opportunity to be in the setting where they will have the best outcomes. It was really kind of cool because the home care patients that I took care of historically were very chronically ill patients. So they were quadriplegics, paraplegics, people who could not move their bodies. Some of them needed ventilator support in the home. They were very, very sick. But we would keep them home. We were invested in keeping them home. So they would go There was a woman who was a quadriplegic for 25 years. She'd never been hospitalized. Excellent home care, perfect skin, minimal infections. So home care has a power, but it has a power for you to bring in care, have it customized, have the burden of the caregiving shared among different family members, but also among with a professional. And then as far as sharing burden of care with different family members, when we were caring for my mother, everybody got a job. My son, he had just turned 13, and his job was to check on Bibi, his grandma, and find out when she was ready to pray. Now, because she was sometimes very weak, she would get lost in her salat, is what she called it. So his job was to, whenever Bibi was ready, to lead her in salat. And one day I came in, this is a very sweet story, totally aside, but forgive me, and she was tearful. And my mom actually didn't produce tears very easily, so when she was tearful, it was a really big deal. And I was like, Mama, what happened? And she said, this is the first time I'm praying behind one of my grandchildren. She said, this is a moment I only could have dreamed of, right? So these are the kind of gifts that blossom out of these experiences of sitting with and of sharing the care. There's gifts in it for every single one. And that was one of the first times that my son, he remembers those days now as like when I used to go and pray with Bibi. My daughter, it would take my mom a long time to take her meds. If you've ever done this, oh my God, she'd have like this meditative experience. It was only 4 pills, but it could take like an hour because trouble swallowing and all these different things. It would drive me crazy. But my daughter, who was home, pandemic, 2020, she was home from college, she was with us. She would go and sit there with her books and her laptop and be like, okay, Bibi, take one more. Okay, take another sip. So she'd spend the 30, 45 minutes that it took. So families have the ability to work together once they understand that the task belongs to everyone.
Beautiful stories. Thank you so much for sharing. I want to switch a little bit and talk about, how can we get our communities and our families to a point where we have better conversations about this? What are things that you find are effective in helping families plan for serious illness or end of life? And what shuts these conversations down? Because I think right now we get to do it and have this conversation because we're up here on these fancy chairs with all these mics. But what should we try and do better in our own homes to have these conversations in a productive way?
Okay. So I have just a few thoughts.
Yes.
When we don't plan, there's so much chaos. There's so much potential for chaos, and there's so many things that can just go completely haywire. When we plan and we take the time to come in and sit down and have the conversations, there's so much more that's possible. So let me put it this way. Here are some things that help. Checking in. Checking in. You talked about what matters most. Checking in and listening deeply. That's one thing that we can always talk about, and we can always be listening for when a person says, I just really want to, what is that thing? For every person, it's going to be different. We can ask questions of ourselves, like if there's a medical thing that comes up especially, it's like, what alternatives are we not considering, right? So that's being willing to kind of think maybe outside of the box, but actually just also think beyond only what we're being told. We might want to ask the question like, okay, so we have this diagnosis, a person, the CHF is worse, the congestive heart failure is worse, we've had to increase these meds, we've had to have this procedure, we've had to add on oxygen now. If a person has CHF and now they're oxygen dependent, even if it's only at night, there's a major change. So now, what might be important now? Let's be willing to go back and reevaluate it. So we get comfortable sometimes with the paperwork, and I'm purposely not really talking much about the paperwork today because we've kind of grasped that and understood, yes, you should have an advance directive, yes, you should have a living will, yes, you should have a will that defines your property. But those things don't tell family members what to do and have those conversations. So I would think that a framework that we could look at is think about the comfort, think about having clarity, and think about trying to control the things that you can control. So having very specific comfort goals, like my mother was able to say, like the pain thing, like, I can't do pain. Okay, that was what she was most afraid of. We can have clarity about what if. So in a really tender moment, you can say, what if this medicine doesn't work like we hope? And you can require, excuse me, let me rephrase that. When that question is asked, you can also allow it to be asked without there being need or expectation that it fully, completely be answered at this moment, but rather that we're posing the question, what if things don't go the way that we're hoping? Because there's this tendency that we want to, as human beings, to have this control that we don't have. And it's kind of a cognitive distortion to say we're going to take this med and everything's going to be perfect and we're going to all get better and life is going to go back to normal. Done. And we become solely fixated on that one outcome. And I just want to invite you into the understanding that if we are fully fixated on one thing happening and one solution, we're moving in the wrong direction. We're automatically moving in the wrong direction. As Muslims, we have to understand that Allah's decree is what will be done, and we get to ask for whatever it is that we want. So inna ma'al usri yusra, right? Allah says ma'a, it's right there with it. So we need to see the ease. He's given us both because in his justice, that's how he loves us. And so when we ask those questions, be willing to just listen, but also be willing to kind of ask the questions. So another thing is like really clear discussions with the medical team. I think that everybody, like the scenario that I just outlined where things shifted a little bit, I think everyone should have a palliative care consult. It is one of the most underutilized tools. It is no threat. There's no signing up for anything. It's just that you get a professional, palliative care trained, who's looking at the entire picture. They're not only looking at what's medically possible, even 1% or 0.5%. They're looking at what is important to you, right? What are the things that give your life meaning and value? Oh, do we need to hold off on this procedure because you want to go and make ziyarah? That's the conversation you can have with palliative care. So how do we shore up this individual so that they can be strong enough to go and sustain this trip? And then how much difference is it going to make if we delay by a week or two? For many, many illnesses, if you're sitting there having conversation about it, it means another week or two isn't going to make a difference. When it's critical, you're in the ER and you're doing stuff. And nobody's deliberating. It's just like, we're going to do this serious thing or that other serious thing, and it has to keep moving. So sometimes the urgency, we have a false understanding of the urgency of the situation. So exploring the difficult questions with the medical team. And then what shuts things down. So what shuts things down are when either family or medical team use euphemisms. Well, that's not best. What does that mean? What are the other options? That's not the best thing that we can do. Or we hope that it's effective. What does that mean? Define effective. Give me a number. And sometimes, this is really probably the thing that hurts my heart the most, if you can't tell. Sometimes we as Muslims, and sometimes individuals from the immigrant community specifically, you show up in speaking perfect English. You may have more wealth than the physicians that you're talking to. You have accumulated and accomplished all of the markers of success in the United States. And you may not appreciate that you're still being profiled and othered in that particular space. That you're still being presumed to be from another place with the odd name and the odd habits. And if you do have an accent, then that's another thing that's added on because perhaps you're also not as intelligent in their perspective. And even if that person is from a non-white culture, they've still been educated in this very secular, very white supremacist system of education. So there are barriers to you receiving ethical, quality care that sometimes people don't even understand that they're up against. And that's one of the places where I have borne witness and really it's affected me the most. And so entering those conversations with the presumption that you're being told everything that you need to know would be a mistake. So when you enter those conversations and you're interacting with the medical team, don't presume that you're being told everything that you need to know to make the decision. And in fact, one of the questions that's a really great question is, what questions have we not asked that we should be asking you, doctor? What's the best case scenario of this situation? What's the worst case scenario of the situation in which you've outlined? It's painful, maybe to hear some of this outlined in this specific way, but it's what I have witnessed again and again and again over the years. And so you have a lot of power if you understand this when you enter into the medical and healthcare system to really advocate and speak very clearly for yourselves.
That was beautiful. There was so much there that I was just writing down as you speak. I think to the last point, I think it's incredibly important to understand how we can advocate for ourselves, especially in this American healthcare system where you're right, we can all be doctors and whatever here, but when we go in, we are often, the woman wearing hijab or the family that prays every, 3 times a day, or the, that patient has halal food, or so we underestimate, the profiling that happens in hospital and in medicalized settings, and also the profiling that happens to, articulating our values and what we want.
Because
So
we
I-
censor ourselves as well.
Exactly.
And we won't speak up about
I
some
think
of
we
the
try
things.
and make ourselves more white. And we do that all the time. We try and over-educate or over-intellectualize a lot of the things that, especially in advanced illness, ought to be emotional. And so I really, really appreciate you saying that. I also really appreciate your framework, and I think it comes back to the 3 things you mentioned earlier in this conversation: truthful communication, comfort in having honest conversations medically about what that could look like, but also honest conversations at all stages of our life and all stages of the various illnesses that you're at, where it's much, much more easy or easier to talk about, what comes next when we're not in situations of crisis.
Absolutely.
And I sometimes think a lot of the language too that we in those situations of crisis is then when we use religion instead of thinking about God throughout our lives and throughout our process. So we, when things are in, dire situation, it's crisis, and we don't know what's going on, then we'll start, you take out the dua book, and then all of a sudden now you're doing all the namaz on time, and now, you're all of a sudden asking for a miracle. And I think this language we hear so much in the hospital. And it's important for us, I think, as Shias here who, as we talked about, have such a rich faith tradition that tells us what we should, the mindset that we should have as we approach death, and the mindset that we should have in terms of not expecting things from people, not expecting certain things, not necessarily needing to not suffer, not expecting those kind of things, but going at it and being like, this is my path towards reuniting with God, and what does that look like, and how can I best prepare and be okay with that path, whatever it looks like for me. And it's very hard to do it. It's easier for me to say it up here, and it's harder to go through it. But I think you've outlined a very beautiful approach that I hope gives everyone in this audience something to think about. It's obviously, we'll all go back to living our lives and, having baraza this afternoon and evening and, the rest of the panels. But even just those moments that you had with your dad talking about what his funeral would look like, or the time that we spent in graveyards, or the time that we spend just thinking, about, what does this look like, is absolutely prophetic and is absolutely spiritual. And it's in that process that even, we're told that we should have our will by our bedside. I remember when I was 10 years old and I was first going on my Ziyara trip, and I didn't know how to write a will, so I printed something out from Q Fatima, which is a UK-based website, and I didn't have any possessions, so I just said that my phone would go to my brother, then my clothes would go to my cousin, and then I had that by my bedside. I still have that will when I went back to Vancouver. But even that, the thinking that we should have in our heads, that this life is not ours, and it is just a loan. It is temporary. It's, I think, why we gather in spaces like this to have this conversation, is to remind ourselves so that when medicalization and, hospital moments or moments in our illness, lab reports, imaging, consults, when they all come, we come back to these moments. We come back to these spiritual practices of thinking about Muharram and Ashura and thinking about, who we are and where we're actually going. So I really, really appreciate your expertise and your thoughtfulness and the stories. A testament to, I think, the work that you provide to the communities you serve, but also the families that you've been a part of. So thank you so much. I know we're running at the end of our hour. I requested a mentee pool to be highlighted so that if anyone has any anonymous questions, they can take a moment just to type them. I don't see that poll up, so I think we can take questions or we can break.
So I'll just say this while we're waiting for a transition.
Sure.
And that, you know, one of the frameworks that I think are really, really helpful for us to explore and hold on to come from Imam Ali when he was struck by the sword on that night in Ramadan. He said the words that echo in all of us, you know, Fudstu wa Rabb Kaaba. You know, he swore by the Lord of the Kaaba that he had succeeded. So he recognized that this return to Allah was an achievement and an accomplishment. And that, you know, as you were just saying, like, to make peace with our bodies as something that we will separate from and leave, and that understand that we do live eternally. And that's where that was the success, is that there's a graduation of sorts from the limits that we have within this material world, and we're going to a space where we are unlimited. I mean, just to really understand what that means in terms of our soul and how we're encapsulated in this material form here. If we can latch onto that, that's another element that can help to reduce the fear. And Imam Ali, he knew that his time was near. He knew that that he was going to be dying, and he took those moments to advise. He could have said, Allah, heal me. He did not. Right? He could have asked for to be absolutely cured of that. But that's not what we have in the traditions. What we have is that he gathered Imam Hassan and Imam Hussein alayhi salam, and he gave them instructions about faith, about family, about justice, what to do to his murderer. He started giving them instructions for what to do and how to live beyond him. And he also even asked that forgiveness be extended to the person that killed them, that would have killed them, that had injured him at that point. And he asked for his family to remain united in taqwa and in piety. So in these final breaths that he took, he still united the ummah and united the people and gave us this powerful example to live by. And that's something that I invite us to hold on to and to grasp and to really use as an example of what our success ultimately looks like. What true success looks like, about the eternity of our souls and our spirits, and to welcome that, and to understand that we have the power to kind of control, very used term, in that moment, what our exit might look like, the grace that we'll use. So the du'as of the person who's dying are powerful, and the du'as of the people who go and visit them are very powerful. There's a YouTube series by Sheikh Rizwan Arastu from Beit al-Ilm in Chicago. And he did this series for the first 15 nights of Ramadan this year. And it is all about this. It is amazing. He literally brings forward content that he looked through the hadith and he wanted to talk about the things that are not being discussed. He talks about chronic illness, what that means, how we should behave, what we should be praying for, death, dying, how we should be behaving and praying at that moment, and all of the behaviors around that and instructions for us. So I really highly recommend that series.
Yeah, beautiful. Thank you so much. Thank you. So I think there is a QR code posted if anybody in the audience has questions. We'll take 5 minutes for questions, and if not, then people can come up to the front. So I'll give people time to take a photo of the QR code on the screen. Yeah, no, we asked before if anybody had questions, and I think this was more a session maybe to think and not necessarily to ask if people don't necessarily have questions. Okay.
Okay. It's not on, but you can turn it.
Yes. So the question I have is, right, when we have our elderly family members going to their last moments, And clearly the advice you've given us, Sister Zinga, is take those notes that they leave you while they're still alive, their wishes and what have, which you did a very good job with your dad, of course. But sometimes you have family members who are going through dementia, who have issues like those. What advice in your experience that you've seen, I'm sure you've had those cases, when your parents are going through those moments, how can you as an individual make those moments comfortable? Do these folks who go through those moments, if you do things that, for example, they remember, or at least they were doing, like for example, my mother-in-law, she was with us during her last moments. We knew she loved to pray. There came a moment when she wasn't totally with it, but there were things that she was doing when she was alive, when she was all with it, that we tried to keep up with. Do you find that those things during those moments when they cannot recollect themselves, but we try to bring them into those moments, is there a connection that they somehow in their mind, even the fact that they have dementia, whatever they may be going through, that they can still connect to when they were fully active?
Thank you, Papa. I really appreciate that question.
Yes.
I always think that, I don't know what thoughts you have, but one of the perspectives that I have is that sometimes forgetfulness in older age is a blessing and a mercy upon God from us. You know, sometimes we say to ourselves, oh, you know, you got to remember all the sins so that you can ask Allah. And I once had an old member of our community tell me, you know, I feel like I don't remember things. Like, you know, in the month of Ramadan when you're supposed to remember and say astaghfar, like I can't remember all the sins that I've done. Like, is Allah gonna forgive me? And the answer that I had, you know, at that time I didn't know how to answer him, but when I thought about it, I said absolutely, because God letting you forget that of yourself is God forgiving that of you. That it is no longer part of what you're remembering about yourself, that He has already let that pass. And so sometimes I think when, you know, we have our older adults who don't remember things, or maybe they forget how to pray, or maybe, you know, they're forgetting things. It's not our job to make religion a tick box religion. That, you know, you have to do Surah Yasin, you have to do this, you have to do that. Like, God doesn't work in check boxes. There is their soul that only God has possession of and knows best. And so what they can do and what is what is a bit like able for them to do is what is required of them. And I think having that forgiveness and that grace, that we put our own expectations upon people and our loved ones, that we expect them to do things, or we feel guilty if they don't do things, or we feel guilty if we don't do certain things for them. But I think forgiveness of ourselves and forgiveness upon, you know, those of us who are older and, you know, getting to places in our lives where maybe things are not always perfect is, I think, one of the most important values that we tend to forget. So I think that's especially true with folks who have major neurocognitive disorder as well.
And I'll just add that when there is major neurological damage to the brain in some capacity, motor neuron diseases of different varieties, what we have to know is that we don't know. We don't know what they're grasping and what they're not. And so I'm taking care of people with cerebral palsy, different levels of Alzheimer's, dementia, Parkinson's, with dementia, without Lewy body dementia. We really don't know. And also it's not stagnant. Their understandings can shift and change at different periods in time. So there might be some moments where they're definitely more alert and aware. It could be based on rest, or based on the nutrition that they've had, maybe even based on a spiritual surge that they've gotten, or even who's in the room energetically, a song that they've heard. Like, it's really amazing the things that might awaken something within an individual. So one is, we really don't know. So if we don't know, then why not presume the very, very best? If we concretely cannot know precisely what they're grasping, like they can't say like, oh yeah, I got that, why not presume the very best? And the thing that's gonna help our hearts feel the softest and feel the most compassionate and get the most out of that moment. So that's one perspective. The other thing is, these moments are for us and for them. So we often think about like, what can we do for them? But there's also something in it for us. When you go and you care and you love and you take care of another individual, it is something that grows within yourself. There's a pride, there's an accomplishment, there's a success. You're magnifying your love for that person. You're magnifying the power of love within the world, actually, and you're kind of feeding the collective overall. So remember that it's not only about what they're experiencing and what's happening for them, but there's also something, because in that interaction, you're feeding yourself. Mm-hmm. There's a hadith that says that The angels go to the person who's sick to record their deeds. And then they see that that person, at the time of prayer, they're not praying. So they go to them at the time that they usually would pray to record it. And then they say to Allah, like, this person, there's no prayer. And Allah instructs them, write it anyway. That's what Sheikh Rizwan shares in the series. Allah instructs them, write it anyway, because it is not this believer's fault that they are unable to pray. So I'm not going to punish them, so give them all of the barakah and all of the blessing and everything that would have belonged to them as if they had prayed. And so that's just a really beautiful way to understand how Allah is regarding it. So basically that illness is their worship, which brings me to the last point, which is we often can look at those situations, especially with the motor neuron diseases, because when people get excellent care, and in our communities they often do, they live long. They live for a long time. And sometimes if they were not getting great care, they would die from infection, pneumonia real quick, from not being moved properly, skin breakdown, then an infection, not getting fed. Because if it takes 45 minutes to feed a person, if they're in certain institutions, no one's going to feed them for 45 minutes 3 or 4 times a day. It's just not going to happen. So when they're home, if they're being well cared for, even in an institution, and they're getting great attention, they'll live. So something that maybe wouldn't have lasted a person whose life expectancy might have been shorter at one point, it becomes much, much longer. Okay, so then we can look at that and sometimes feel bad. But the reality is that all of that is opportunity. All of that is Allah giving that person an opportunity and giving them, and they're worshiping, and their illness is their worship. So we can understand that, and we have the gift of time to serve them and and for them to experience that illness, and it's not a terrible thing. It feels bad to us, but it's not a terrible thing.
Okay. Thank you, everybody. I think we will defer because we're ending time, so thank you so much for listening to us. You started off this talk with a verse from Makarim al-Akhlaq, and I will end it with a verse from Makarim al-Akhlaq, that Bismillah ar-Rahman ar-Rahim, O Allah, let me live as long as life is better for me, and cause me to die if death is better for me. So we leave it in the hands of Allah subhanahu wa ta'ala. Salawat ala Muhammad wa ali Muhammad.
Allahumma salli ala Muhammad wa ali Muhammad.
Sister Zamina, Sister Nzinga, thank you so much for such a thought-provoking presentation. I had tears in my eyes for much of it. Just really a well-needed topic and a well-needed conversation. So thank you again. Now we have 3 simultaneous programs happening. And as I'm explaining what the 3 programs are, Sister Ruhina will make her way to the front to do our final raffle. We have the men's nutrition and fitness program happening in this hall. We have the women's healing circle happening in class 7, which is at the front of the hall. We can guide you there. And we have the women's pelvic health exercises happening at the back of the men's hall, and one of us can lead you there. Before we do the raffle prizes, Sister Nzinga, can you just tell us who should come to your healing circle and what should they expect?
Sure, thank you. The healing circle is really another way to think about it as a story circle. So you can see there's a lot of power in the narrative and the stories and our ability to formulate them and then share those stories. So anyone who wants to share a story that's meaningful should come.
Fantastic, thank you. Okay, here we come for our final drawing. And there, at the end of the next sessions, the 3 sessions I've outlined, we can pray Maghrib Salah together, but I did want to take this moment to thank all of you for taking the time to come and spend the day with us. We hope that you learned something. We hope that you were able to connect with the professionals that you wanted to, and inshallah we're willing to accept any feedback that you have. And while we're waiting to just draw these raffle prizes, I would request a Surah Fatiha. We've received another donation in the name of Marhumin. So everyone, if we could have Surah Fatiha. Bismillahir Rahmanir Rahim.
All right, let's do electric blanket. You could say it.
Okay, we are raffling off an electric blanket. Let's see who is going to win the electric blanket.
Fatima Jamal. Electric blanket.
For being in the front row, Sister Fatima Jamal, you have won an electric blanket. Next, we're raffling off a pair of 2-pound dumbbells. Shabnam Alibai. Sister Shabnam Alibai, you have won a pair of 2-pound dumbbells. Come on up. We are raffling off a pair of 2-pound wrist weights. 2-pound wrist weights go to Sister Hasina Mupan. Sister Hasina, she left. So another one? Okay, so I think she already won one. Yep.
Would you prefer these or these?
Next, 2-pound wrist weights are going to, that's you.
One is a wrist and one you have to hold in your hands. This is the wrist. Yeah.
Brother Hussein Karmali. Brother Hussein Karmali, you have won a pair of 2-pound weights.
Call Sakina instead.
They are pink, so I will call your wife to come up and claim them. Oh, sorry. Okay, request Brother Hussein if you can come up and claim your pink weights. And is this the final prize?
No, we still got more. We got those dumbbells.
Okay, we're still going. Multi-level back stretcher is going to Sister Anar Murji. Multi-level back stretcher.
Congratulations.
Come on up. Okay, we still have a few more prizes.
Everybody in your house is a girl, that's why. Yeah. We have two, yes, this is for you, for babysitting. Zermeen Mustafa? Zermeen? Let's pick this one. Fatima Mukaddam, I think you're still here. You get 1-pound weights. Okay. Oh, you don't want it?
For a water bottle?
Yeah. Okay. Zamina Aziz, you get 1-pound weights. There you go. Traded with the senior. We have 2 water bottles. Fatima Habib, you get a water bottle. She was in the back. Yes, we're going to give that one to you.
Okay, and next one here. Hold it already.
Jawad Sharif. I saw his wife though.
I saw him. I don't know if he's still here.
Sakina Hashim, we have your water bottle. Which one are we doing? We can still go to this.
Okay, thank you so much.
This is for you.
Appreciate that. Thank you.
Okay, we have 2-pound weights. Pick someone else. She already left. Fatima Kalfan, you get 2-pound weights. Fatima, in the back. We're going to get it to you. Here, give me this one.
Okay.
Slow down and enjoy life. We'll do it again. Rifat Auntie, you get a book. Slow down and enjoy life. But I think you're doing it already, so I don't know. Here you go. Empowered Wellness. Suki Rahim, I saw you earlier. We're going to get this to you. Yeah, there you go. 2-pound.
Okay, and the last one?
Shumaila, weight-free training. Shumaila. Listen, Mikey got. What did Mikey get? You gave Mikey.
I gave the neck
was
pillow.
it?
She's
The neck
got
pillow
it.
was Mikey's.
Oh,
What
okay.
did her mom win? Daira Habib. Oh, yeah. Okay, fine. So it works. Okay, we're done.
That's it. Okay, so men's nutrition and fitness is happening right now in this hall. Rising After Loss, Women's Healing Circle, Class 7, which is at the front of this hall, and pelvic health exercises are at the back of the men's hall. We're going to get started promptly because we do want to conclude with Maghrib Salah.
He can give this out.
Yeah, he'll start. Alright, I guess I'll start. Should we go over there? Yeah, right, okay. Alright, we'll just do it quick. Just get it out of the way. Okay. Assalamualaikum. How you doing? Alright. Yeah. Hello, Assalamualaikum everyone. I know we're still waiting for more of the men's to be coming for men's health, but we'll give it a few more minutes.
I'm just gonna go grab my computer. I'm leaving.
Yes. We'll be starting shortly. Hello. Okay. So we're going to be starting soon. For those who get to stay for the whole session, there is a $1,000 prize at the end of this session. So for those who want to sit in, each and every one of you will be awarded an IOU of $1,000 of an undisclosed time when you will receive it. Therefore, so as far as like what we're going to discuss, I have our brother Mehdi Bandali and myself, Imran Sayed. I work in nutrition and I work for Northwell Health. I've worked in the field of nutrition for almost 20 years now, and it has changed throughout the years, especially when you are living in America. As for physical health and exercise, that's been pretty much at the forefront of this nation's, motto to help keep you in shape. More or less, at times it has been great, and then other times not so good. But now moving forward, as a nation, what's very important now for men's health in particular, we always hear a lot about in terms of women's health, and there's a lot of attention paid to that. But when it comes to men's health, it's still now coming in the forefront because, we're men and we don't really speak up as much about what goes on. We just grin and bear it and we move on. That's it. That's just a part of life. That's how men are. We just deal with the situation at hand and that's it. But, alhamdulillah, now, widespread population is, the public is understanding that there should be attention to men's health as well. So I would say, myself, being, born and raised in this country and seeing, elders, it's very important in terms of for not only my generation and my parents, not only my generation and the younger generation, but it's still important to take care of and preserve the parents' generation. In terms of those who are approaching the 60s and 70s, even 80s, and alhamdulillah, there'll be those who are in their 90s. So the thing is that if you take good care of your health overall with good proper nutrition and lifestyle and movement, these things are preservations. And it's beautiful because, Allah has already put that into play for us 5 times a day. So 5 times a day, you are in motion. And that is already implemented in terms of physical movement, as well as mental. That's implemented, as well as when you're memorizing Quran and you're reciting and everything. So Allah has already put all these things into play for preservation of the mind, body, and spirit. Now, when it comes to as we get older, there still should be some level of proactivity of exercises, being that we have a community. So always, that's great that, there are some communities that partake in sports. Sports is very important, as well as when it comes to just interactions and relationships. All of these are very important in overall the health and well-being for men overall. As far as where I would touch upon, I definitely would touch upon, I work in nutrition, so overall, I've been more focusing a lot more this year on digestive health and basically choosing the right foods and healthy foods. And I know some of you may know me. We've had sessions where we've discussed in terms of food choices and everything. But I won't gloss over that now. It's just in general, what's very important is that I just want to start off with this message is that you're never too old to continue with your health, exercise, even building muscle. Allah has created, even those in their 70s are able to build muscle. And it's very important that if you are, let's say, in your 60s, to maintain muscle, because every year as we age, we are losing at least 1% of our muscle mass. So you don't want to become frail by the time you're in your 70s. You want to make sure that you have some preservation of muscle as well as well-being, movement, not having rusty joints and all that. So overall with physical health, I will hand this over to Brother Mehdi. He's the personal trainer and expert of movement, but I wanted to start off and end this with basically it's never too late in terms of exercise and movement. Exercise is very important. Always watching what you're eating, taking good care of your health, all of these, you keep it in moderation and overall for a longevity of your life. I mean, we have the genetics for it, but sometimes it's short-lived with lifestyle. So overall, just pay attention to that. Inshallah, we'll also set something up for the uncles and men's health for a one-on-one for a nice longer session, inshallah, in the coming months. All right then, take care.
Assalamu alaikum, everyone. My name is Mahdi Bandali. After high school, I became a certified personal trainer. So I've done that for 3 years. I've trained over like 50 clients, mainly in senior population. And now I go to college for an unrelated field, not like personal training. So yeah, to echo Brother Imran's sentiments, like movement is very important. And, you know, like one story I have is a client from this community who is 65, you know, had a problem bending down, praying namaz, and after, you know, 3 months of consistent workout, they're able to pray, sit down without any pain. And this client had knee surgery. So, you know, the consistent movement is key, right? So at least like they say, you know, 30 minutes a day, 5 days a week, you want to target around 150 minutes. And the main thing is resistance training, because you are losing muscle mass. So it's important to keep your bones and your joints healthy and your skeletal muscle mass like preserved long term. So more than like cardio, a lot of people in our community, they say, oh, like I play pickleball, I play soccer, I'm good. But we want to get that posture right, you know, those muscles in your neck and your spine to be healthy. So it's very important to, you know, go to a gym, but also it's important to do things correctly, right? So having correct form, correct coaching, correct guidance, that's also important. Now, one thing like I like to incorporate in my own workouts is stretching, and I think everyone here can benefit from stretching because a lot of people are sitting in front of a computer a lot, like all day long. Also, like all the tasks we do are in front of us, right? Whether we're driving our car, we're in front of us, you know, working on the computer, cooking eggs, for example, your hands are in front of you. So it causes some rounding of the posture, right? Also sitting, like the way I'm sitting right now, not the best posture, right? This is how we sit normally, right? So, you know, to fix this, right, getting yourself active, working on corrective exercises, working with physical therapy, all these different things are important to live a long, healthy life where, you know, you're 80 years old, you can still run after your grandkids, right? So those things are important, but nutrition also comes into play here. Brother Imran can talk more about the nutrition side, but you know what I want him to talk about is like, okay, so are we going to eat unhealthy, for example, like, you know, all the time? Is it once a week, for example? How can we structure our meals so that we're eating like a core 80% of our meals are healthy, where it's like rice, chicken, oatmeal, you know, like those sort of healthy foods, and then we come to mosque in Ramadan, and that's our time to like enjoy, and then we can have our biryani, you know, our palau, and enjoy. What do you think, Brother Imran?
Sure, I could go into that. As far as when it comes to food choices overall, it's understandable. There's a cultural way of eating, right? In terms of cultural way of eating, desi, pretty universal. Desi culture way of eating is always carbohydrate first. Chawal, roti, you know, aloo. It's always that first. But it's very interesting, studies are being shown that the order in which you eat your food actually will affect your blood sugars. So now you can take a different approach. Instead of basically whenever you get your plate, I'm not taking your chawal away from you, don't worry. I'm not going to take your chawal away from you or your biryani. But what I would tell you is the order in which you eat your food should change. So how would that be? Okay. In terms of, you definitely should include vegetables into your diet. And what does vegetables do? It has fiber. And when you start off with fiber, it helps with that feeling of fullness, as well as protein. Protein would be like your chicken, your kebabs, your beef, your lamb, goat, anything in terms of protein, you want to follow with that. Protein and your vegetables should go first. Why is that? Protein helps with your satiation. The problem with when you eat chawal, we eat a lot of it because we can't get enough of it. And the thing is that because the chawal is cooked, it's very easy to chew it. It's very easy to eat 2 cups and not even know what happened, you know? But when it comes to vegetables, you have to work with it. You have to chew it. You have to work on it. Same with protein. And the good thing is this, is that there is a connection between your brain and your stomach. When you look at food, it sends a signal to your brain and your stomach starts churning. It's getting ready to receive the food. And chewing your food actually extends the time of digesting. So the less you chew, the less you're going to have that level of digestion where the food is sitting in your stomach. So the thing is that what are you chewing less of? Chawal, roti, the carbs that are like over-processed. You just take a couple of bites, right? You're not really counting how many bites. What's one spoon of chawal, how many times are you going to chew that? 2 times? 3 times? Not even once? There's some people inhale it, you know? So, but at least with vegetables, without a doubt, if it's, you know, partially, I guess like you guys may say, like think it's kacha or like raw, you have to eat it kacha. That's how you're supposed to eat it. You're not supposed to eat it when it's overcooked, all right? It shouldn't be like a salan. It should be somewhat kacha. It should have like a snap to it, a crunch. And that is also very good because then you spend more time chewing it. And the more time you spend chewing your food, the quicker you get full. That's the magic. So you don't eat a lot. Your portion sizes are controlled. So these things are very important when it comes to the way you eat your food. The way you eat your food is very important. So everyone tonight will go home. This will be the dinner exercise. You're not going to, I would say with the carbohydrates, you're going to this time do half of it. All right? It's dinner time. Dinner portions should be less than lunch. It should not be greater than lunch, although most of us, we do love our dinner. But I would suggest, just for tonight's exercise, so maybe you might like the exercise and repeat it again tomorrow and the day after, which I would recommend. But put half of the amount of carbs on your plate. You can enjoy more of the protein. I mean, not as much of the salan that comes with the protein. I would say fish out all of the meat out of it and use the salan for something else. And the vegetables should not be fully cooked. Give it like a halfway cook where it still maintains its snap to it. And then start focusing on eating the protein first and the vegetables. Spend your time chewing it. You should be chewing. Don't be a fast. How many of you think you're a fast eater in this room? Raise your hand. Who thinks that they're fast? Who takes 15 minutes to finish their food? 15 minutes or more? Raise your hand. Or more, yes. Okay, good. Now, all right, so you're spending your time chewing your food. Very good. For those who don't want to admit that they're finishing their food fast, I would suggest chewing your food, spending more time. Minimum, give yourself 15 minutes. Put a timer on your phone and see how quickly am I finishing my food. Because that's going to be very important. Digestive health is very important. You don't want to develop other problems that occur with fast eating is heartburn, reflux, having acid coming up, indigestion. And it's not just I'm talking about one night. We're talking about a habit of many weeks, months, even years. So if you are dependent on things like Pepsid or some kind of antacid, that is just putting a Band-Aid on the problem. You don't want to put a Band-Aid on the problem. You want to solve the problem. And what is the result of, what is a solving of the problem? Take more time chewing your food. Spend more time with chewing your food and finishing your food. So digestive health is very important. Even with longevity, in terms of good health, digestive health is a part of longevity. What is it that Islam teaches us is keep, 1/3 of your stomach full, or is it half of stomach? 1/3 to half? I guess I try, I do it all the time, so I'm so used to it. But as far as keeping part of your stomach empty so that you can breathe. If you can't breathe, then there is a problem, okay? There is a problem. It's not a problem to love the food, but when we're having too much of it, of course, it becomes an issue. Food is a fuel. So we have to treat it like a fuel. If you're going to overload on the fuel, then your body stores the fuel. And then it keeps storing it, and then lo and behold, you have a tank. right in front of you. So that's what we don't want. We don't want a big belly, which is the tank, and we want to slim down on that. So again, the take-home message for that is focus on the order you eat your food. This time, you're going to eat the protein and the vegetables first, and then you can spend some time with the carbs. I hope that was helpful. What do you think? Yes, good?
Yeah.
You have anything to add to that? Here.
Yeah, for sure. So an analogy I tell my clients, right? Like, and we won't, after I say this, maybe we can open it up to questions before, namaz time. So I tell my clients, like, let's say we're going on a road trip to Canada. We're all familiar with this journey, right? So we take out our car. Let's say we have a Tesla nowadays, right? So the EVs. So we're going to leave, and then we charge our car, right? That's the smart thing to do. When we get back home, it's maybe midnight, so we just put our car in the garage and we charge it. So there's no need to charge the car when you get back from the trip. So, proteins, right, are like what's going to fill you up, what's going to help build your muscles as well as help you recover. And the carbs are just that fuel, right? So when Brother Imran says, have the carbs at lunchtime more than dinner time, right? Like that makes sense because like you don't want to fuel your car when you're done with your journey. There's no need to do that, right? Like you can do it. It's not a problem in a car, right? But in the body, that's where we add excess weight, right, to our gut, and that's not healthy. So I like to structure my own day where I eat my carbs like more in the morning time when I know, okay, I'm going to be active, from 9 to 5, and then at 5 I'm going to go to the gym. And then after 5, like I tend to ease off the carbs just so I can like, stay lean over the years. So and now we want to answer. Do you have anything to add to that, Brother Imran?
Yeah, sure. So as Brother Mahdi was saying, in terms of having more of your carbohydrates in the day, I usually make recommendations to patients I see for weight loss management. It's called front-loading your calories. So you want to have more of your breakfast and your lunch, because that's where you are doing most of your capacity work, physical work and mental work. Believe it or not, the brain does consume 20% of the fuel that you're eating. So the brain in it of itself is a machine that is consuming a lot of fuel. So if you're doing a lot of decision making throughout the day, then that's when you want to have most of your food, your calories during the daytime. And then the nighttime is when you start basically slowing down. There is a system that Allah has created, and our bodies were all synced with the sun. When the sun comes up, it sends a message to the body and the brain to get ready for the day. Wake up. Metabolism goes up, ready to take on fuel and energy and work activity. When the sun goes down, it's sending the message to the body, all right, slow down metabolism, get ready to sleep. That is basically, if we were to take it in the most basic sense. But being that also a part of like culture, like the culture in New York culture, New York tends to be more of we tend to be more night people. If you go to a different part of the country where there's more sunshine, you'll have more day people. Like if you go to the West Coast, California, where the sun is out more and everyone is out during the daytime and the weather is great, you have more day people. But when it comes to New York, we tend to be more night people, and what happens with night people? We eat more at night. That's what happens. We work during the day. We don't want to eat the lunch, so we could keep focusing on our work and work through the lunchtime, but I'm going to get home and I'm going to have a nice dinner. But then what do we do after the dinner? Are we doing any physical work? No. We're laying down. It's drama time, or it's dessert time, or it's gupshup time or gossip time, whatever works. Nonetheless, not good on the gossip. I don't promote it. But, just some ladies are here, so, But overall, for the gentlemen, I would say start making a concerted effort every day to just cut back on the portion sizes at the dinner. Eat more during the day. That's when you're doing most of your work. For the evening time, just cut back on the carbohydrates. You could still enjoy your vegetables and your protein. That's fine. But I would say when it comes to the carbohydrates, if it's rice, if it's potatoes, if it's rice and potatoes, which I don't recommend, also choose one carbohydrate. Remember that. Choose one carbohydrate per meal. Try not to do the chawal and roti combination, or do the aloo chawal combination, or some people even are crazy enough to do the pasta rice jowl combination. So these combinations are not good. Unless you're going to be going on a hike, unless you're going to be building a house, unless you're going to be doing some gardening and you're going to be, tilling in the agricultural land, that kind of excessive work, then I'll give you the green light. Sure, no problem. If you have a farm that you're working on and you have to tend to livestock, then okay, you can eat like that, no problem. Because you need that fuel to constantly. So now you understand carbohydrates is an instant fuel for physical work. So even when you go to the gym, like Maddie was saying, if he's going to hit the gym, he's going to load more on the carbohydrates. That is the fuel. Your muscles to use that as the fuel to basically lift weights and do physical work. If you're eating all this jowl, then you're not doing, and the only thing you're lifting is a remote. I don't recommend that much jowl. I'd rather you enjoy more of the vegetables, enjoy more of the protein, and if you want a snack, you can have some fruit after dinner. Something like that would be a good combination. So it's a level of moderation that's very important. If you can fashion your day like that, you'll start seeing a very big difference in your digestive health, your mental, in terms of your alertness. You're not going to feel as lethargic in the evening. So just being alert is very important. And as far as like being physically active, again, looking at food not only for culture, or if we look at food because we enjoy it, or if we look at food because we have each of us has a relationship with food, also look at it in the end as fuel. We need food to function, therefore try to control in terms of how much you're having, despite if it's your favorite dish or not, because just look at it that food is going to help you function for the rest of the day. And if you find that you're having a track record of getting very groggy, very sleepy after eating, then chances are you're having too much of the good stuff. You want to scale back on a lot of the carbohydrates, the bread, the potatoes. Yes, I have a question. Yes, brother. Right. Right.
What would you suggest and recommend? How often, let's say in the morning, you want to have that?
You're talking like a fruit smoothie or something like that? All right. So,
without putting any sugar or anything like that.
Okay, yeah, just as it. Of course, yeah. So as far as brother was mentioning, regards to, let's say you want to have a fruit smoothie in the morning, right? Okay. When it comes to a fruit smoothie with no added sugar or anything, the difference between a smoothie and a juice is that the smoothie the fiber is preserved. It's not thrown away. In a juice, it's thrown away. That's the good stuff. The fiber is what helps in controlling your blood sugars. The fiber is what allows to help you control in terms of your body not taking up too much of the sugar as fuel and then storing it. I would say in terms of recommendation, depending on your lifestyle, if you feel that you want to go light in the morning and let's say have something, I would still recommend for you to add, let's say, some kind of a protein powder to it, some kind of protein element to it, because again, protein intake is very important. And usually I usually recommend that if you want to go light in the morning, you can add like a scoop of a protein powder, and then even Greek yogurt you can add to that. It'll give you a lot of good in terms of amount of protein with the fruit. And I would say don't add any sugar. Worst case scenario, if you want some kind of sweetness, add something like honey or like agave, something like that, where it will not in terms of spike your blood sugars when it comes to that. But yeah, as far as a fruit smoothie, if you want to do that, it does reduce the calories. And if you're looking to lose weight in that sense, there's no harm in like alternating on days if you want to do something like a smoothie with like a protein powder. But the protein is recommended at each meal. Highly recommend to take your protein intake, because I would say, as we're getting older, like I had mentioned before, you want to work on maintaining your muscle. That's primarily what's the most important thing, so that when you enter your 70s and your 80s, you're not losing too much muscle where your body gives in to frailty. So those things I want you to be just very well aware of. But you have anything to add on to that?
Yeah, I don't have anything to add. Those are good points. Now I do like to stay away from like the whey proteins and stuff. So Greek yogurt I find to be a good supplement. But do you have anything before we take a break for namaz?
Sure. Well, as far as like closing statements, yes, when it comes to, and the reason why I usually sometimes recommend the whey protein is only because number one, it's for those who are, I aim it towards like for those who are 50 plus. For the young ones, yeah, they can consume a lot more calories. They can have more. They can, in terms of 40 and below, or even like 40 years old and below, they can do other sources of protein. But when it comes to getting older and you're going into your 60s and 70s, then something like some kind of a protein powder, whether it's and I could always, if you want to know more details afterwards, I could always give, let you know in terms of the specifics of a concentrate versus an isolate. But I only recommend that because it's so much easier to take in. It's an easier way to get in protein because it's sometimes very challenging as we get older. Appetite may not be there. The capacity to have that. Sometimes Greek yogurt could be a bit too heavy, and then you're not feeling hungry later on, and you may not want to eat during the rest of the day. Then you're losing out on your further protein intake. So a protein powder is one way to easily get in protein into your system. And again, I would only address that age specific wise. It's not a blanket statement over all ages. I would say for those who are like above 55 and above, I would recommend like a protein powder because it's very easy to get protein into your system. So should I just wrap it up then? Okay, all right. So yes, I got questions. Yes. Repeat that. 2 eggs and 2 roti.
4 eggs, 1 roti.
Let's do 4 eggs, 1 roti. More protein. 2 eggs, you'll get maybe up to 15 grams of protein, but then you're countering it with too much carbs. So cut back on the carbs. You could do more of the protein, and then you could do a little piece of fruit too, as well. So, yeah, good, excellent. With the egg, I mean, some people just eat the eggs. Some people like the protein, but if you need something with it, again, I would suggest in terms of a better source, like if it's like the roti, in terms of like if it's made with white flour, obviously white flour is very easily processed and your body breaks it down and your blood sugar spike. Something like more like a whole wheat or something along the lines that will slow down. Even rotis made with different types of wheat flour, that will also help with controlling and regulating your blood sugars. But again, you have to look if there's any like makhan on it or anything like that. Yeah, I'm talking like a dry roti, all right? A boring dry roti with like, you have your ande. Oh yeah. And excuse me? Yeah, that's fine. Yeah, olive oil is good, yeah. Yeah, that's fine. Yeah. Extra virgin olive oil is very important. That is the golden standard. If you're going to use olive oil, it has to be a dark glass bottle. That's all you have to remember. Dark glass bottle. Olive oil, that's the true, it's not like tampered with, because some olive oils come in a clear plastic bottle. That means that it's mixed. It's mixed with another cheaper oil. So you want to use a dark glass bottle. You will know you're using a dark glass bottle because you paid an arm and a leg for a dark glass bottle. And that's good. It's worth it because it's medicine. And Allah even said that the olive talks about the zaytun. There is so many benefits in that. Cardiovascular benefits in terms of health-wise, also in terms of joint health. All of these things, it has many benefits to it. So that's basically a good way of identifying you're getting a good quality olive oil. It should be a dark glass bottle. So nonetheless, we'll wrap it up. Thank you very much for your attention. Inshallah, we'll have some more sessions in the future, and also, address a lot of these ongoing questions and figuring out how to properly eat to help with weight maintenance, and for those who want to lose weight, also we could work on weight loss. So till then, take care. Thank you very much for your attention. Take care. Assalamu alaikum. Yes.